speaker. This is
1 2 1 2. Please kindly check all the online.
speaker.
Okay,
We would
sounds
like to
good.
do a final audio test
All right, sounds
with
good. Sounds
with
good.
1 second. We would like to do an audio test with John Engasong, who has just now joined. John, may I request you to please unmute and turn on your camera to do the audio test.
Can you hear me?
Can you just speak for about 5 seconds, please?
Yeah, can you hear me?
Yes, we can hear you loud and clear in the room. Thank you.
Okay.
Thank you.
Thank you.
Back to the speaker. afternoon, good morning. I would like to do an audio test with Dr. Tato from South Africa. Dr. Tato, may I request you to please unmute your mic and turn on the camera to do the audio test.
Okay, I have opened my mic.
Apologies. Can you please repeat again? Apologies. May I request you to please unmute and redo the check?
Thank you, Chair. This is Dr. Chidare Gire from South Africa. Are
Perfect.
you able to hear me now?
Yes, we can hear you loud and clear. Are you going to use the camera? Can you please turn on the camera for us? Will you be using the camera today? Dr. Tato, will you be using the camera today? If so, please, can you turn on the camera?
My camera is open.
Okay, we can see you.
Thank you.
Our UCD will call you later. The UCD
Thank you.
from States will call you later. Thank you. No. Thank you. Ministry of Health from Zambia. I would like to do an audio test with you. Ministry of Health from Zambia, may I request you to please unmute your mic to do the audio test. Ministry of Health Zambia, may I request you to please unmute your mic in order to do the audio test. Ministry of Health Zambia, may I request you to please unmute and do the audio test with us.
I
Thank
won't
you.
take much time on opening remarks because we need to get to the piece of the matter. Next item. Adoption of the agenda. Any proposals to adopt the agenda? Would they have proposed the adoption of the agenda? Ma'am, please.
Ministry of Health, can you speak close to the mic?
Can you hear us?
Some said
Can you hear us?
Yes. Can you just speak for about 5 seconds?
on the
Just to make sure
agenda,
that the volume is okay?
correction and.
Okay, so we can hear you loud and clear. I hope this is also audible on our end.
Yes, thank you very much. Will you be using the camera
Thank
today?
you.
Will you be using
Yes,
the
we will
camera?
use the camera. Yes, we will use the camera.
Can you test it for us, please?
Are you able to see us?
Yes, we can see you. Thank you. Thank you for that.
Great. Thank you. Thank you.
Thank you very much.
Um, Distinguished ladies and gentlemen, I have a lost and found phone. I usually have a habit of keeping these things when the event ends. And I have a lot of wonderful things back home. So if this is yours, and unfortunately it doesn't have your picture or your child's photo, your pet, does this look like yours? It was on the high table. No? Okay, I'll be calling it once. I'll try to see if I can get it to whoever it belongs to. And interestingly, it seems to have been recording all the while.
Check. 1, 2. 1, 2. 1, 2. And then
I found the owner, so we're good. So it's customary that we stand when the time arrives and we put our hands together as we welcome the guest of honor into the room. We'll then take our seats and proceed as per program. There might be a few switches to the program, just a little bit, but we'll indicate those just before the slot arrives, ladies and gentlemen. So I believe all our online speakers are good. Give me an indication. All right, great stuff, good stuff. Very well. Audio is good, visuals are good as well. So that we don't waste too much time as masters of ceremony, I'll be continuing this with Dr. Catherine Joachim, who's done a fantastic job in the morning. You may not have the latest program with you. But we will welcome the Honorable Host Minister for Health to speak first. The Minister of Health, Kenya, will speak next. And distinguished ladies and gentlemen, your honors, all the speakers, may I please request that we use this lectern, which is my left, probably your right if you're looking at me. So if you're not seated at a high table, please proceed by coming up these steps, and we'll speak from here. We'll then hear from the State Minister from Uganda, and we'll have creative input from adolescent girls living with HIV. I'm not acquainted. Where are you? Mko wapi? Mabinti ambao mtakuwa na kitu bunifu hapa mbele, naomba niwafahamu. Ambao wamewaandaa, those who prepared them, are they here? Are we ready? Tupo tayari? Sioni mkono. Dadangu Leticia, sijakuona leo. Uko wapi? Unajua una tabia ya kupendeza sana. Mbona umekaa mbali sana? You're seated too far away. Lazima nikakuleta karibu zaidi, ili usitokee mbali sana. Karibu. Kama hutajali hata nikulete kwenye viti vya mbele hapa. Ni mzungumzaji muhimu sana. Sasa hao mabinti wako wapi? Leticia, karibu huku. Uwe karibu zaidi na eneo la kuzungumzia.
Good afternoon. This is an audio check for those who are online. I believe now the volume in Zoom has been rectified. Can you please confirm on the chat? Thank you. Thank you.
Yes. Naomba nikaribishe kikundi chetu kilichokuwa kinaburudisha hapa mbele cha ngoma. Naomba mje hapa ndani ya ukumbi. Tunapiga taratibu kidogo, alafu wakati mgeni wa heshima anaingia, tutaongeza tempo kidogo. Kikundi chetu cha ubunifu, naomba tafadhali mje ndani ya ukumbi. All right, twende taratibu. Well, I hope you enjoyed that. Very vibrant, huh? And if you couldn't catch the Swahili, it's all right. They stayed within our messaging. At the very end, I'm not really sure if that was a child being carried off, maybe the wife carrying off the husband. I'm not really sure. I couldn't really tell very well. Yeah, but I believe that's, that's how they created that. So we're waiting the arrival of our already with us, just to get into the hall, and then we'll proceed. I'll do the protocol introductions of the distinguished and esteemed VIPs at the high table. And we will then follow by requesting the Honorable Umi Mwalim, the Minister of Health, to speak. And then we'll go straight over to you, Mama Leticia Morris, National Council of People Living with HIV. You will have a chance to speak. I am waiting for your speech. You usually have the best speeches. Although it's called a political launch, you don't get political minutes. Oh, Leticia. So within about 2, 3, 4 minutes, if you could deliver, it would be great. And if, distinguished ladies and gentlemen, that's about the time allotted for everyone. And so with all the other speakers coming through, please just maintain your good pace and time. I'll be running this program with Dr. Catherine Joachim, and so we'll be sharing slots. Whenever there's a chance to go check whether the technicals are ready, I might be running off to do that, and we'll be roll calling the ministers for your statements. So please prepare for those. And once again, we're all speaking from this particular podium, and the other podium is reserved for our excellencies. We have 2 vice presidents joining us. It's quite unusual, but we've been able to do that, as the Zimbabwean vice president is also has the docket of Minister of Health and Child Care, very relevant to our subject today with the alliance. My good friends with technicals, just a quick one. After the Minister of Health, Kenya and Uganda, we're going to move up the Cote d'Ivoire rep. Are we good with that one? Ready? Okay, great stuff. So let's make sure that our line is ready. And we'll also have a video, a 2-minute video from the Africa Director, WHO. And we're thinking of putting that down just after 12:10. Is that also indicated to you? No, it's not? Okay. Dr. Chidi Ndeti, the 2-minute video, Africa Director, WHO. Okay. We do have a bit of time. I'll come over and sort it out with you. At the high table, we have the Health Minister. The United Republic of Tanzania is the mainland Tanzania. We're in Dar es Salaam. Used to be the capital city, now the business capital. Our capital is Dodoma, central Tanzania. And we also have the Zanzibari minister, seated a little bit lonely at the far end of the table. And so every time we have meetings like this and we have ministers from other African countries come through, I'm sure once we start touting our natural beauty and resources and tourism attractions, you all feel a little bit like Zimbabwe also has this, or Zambia has that. Kenya has the other side of Mount Kilimanjaro. All right. And so if you look around the room, I believe you can see history that takes into account and respects very much how allied we were as African countries. Look at the pictures of the presidents, our former presidents, who fought for our liberation. I believe you seeing that, it should certainly motivate you, and you should feel that Tanzania continues to honor, appreciate, and truly believe that our participation in the politics of the regions was instrumental for our own development. And so as we tout peacefulness in Tanzania, it's what we've known because it's what we fought for everyone. And you can see around the big 4 or 5 that you might also have in your own country. Our president, Dr. Samia Suluhu Hassan. I'm not sure how many of you have a picture of your president driving a safari jeep. And how many of your presidents have had the pleasure of doing a royal tour for your guests? And so if it's a first for Africa, why don't you put our hands together for Tanzania and Her Excellency. As a show of hands, distinguished ladies and gentlemen, how many of you have had a chance to actually see the royal tour, the video? Yeah? Okay. It's pretty much local. It's everyone here probably had a screening in your offices or at the US Embassy or so forth. But if you haven't, why don't you source it? It's a pretty good, thank you for taking the pictures. It's a wonderful way of promoting your country. And if you look at the video, it goes deeper than just simply the national parks, but things that we feel are important to Tanzanians in both the mainland and also Zanzibar. It has a sort of a personal touch. You get to understand the president a little bit more. I read a lot into politics, and I'd like to say kudos to the Zambians. Congratulations to you. The news that's coming out of Zambia is very encouraging. You also have a very enigmatic president and ministers as well. Congratulations for what you're doing. Yeah, I'm reading the news from there. I believe Africa should read on itself, ally itself a lot more, and we can learn a lot from each other. So you can take that back home and say, we heard good things about our government, our ministers, and the wonderful drives that you have. Very, very innovative and forward-looking. That's what we need. And to get this to happen by 2030, I believe that's what we'll hear in the declarations from all of you. So kudos to you, Zambia. We have the First Lady here from Namibia. We'd love to hear from you as well, on the work that you're doing. Namibia is kind of quiet on the African news radar. It's one of those countries you don't really hear about very much, all right? But we're very pleased to have you here at the table, at the high table. Karibu sana. So that's my good take. If you have a bit of time, and we always encourage you to have a bit more time, pick up a little bit on Swahili. That's another thing that, oh, are we going to watch the video, or is that just still there? Pick up on Swahili. We're not touting it as a language for Africa just because it is from Tanzania, or better done in Tanzania and being really trashed in Kenya. The Kenyans have a way with Swahili. Whether you're on the coast, maybe the Mombasa coast is pretty good, but in Nairobi, oh my goodness, I wouldn't survive with my Swahili in Nairobi. But we are very friendly neighbors. We are practically brothers, sister, brother countries. And Uganda needs to do a little bit better with the Swahili. And you will find it now all over the world. And so one of our major exports, once again, is our language. And I hope it continues to unite us. A market of over, how many millions? Almost 1 billion in our regions, whether you're in South of Africa, Central Africa, and also a bit of the North Africa as well, towards the eastern coast. So if over 1 billion people can speak a common language, imagine what that would mean for our own development. And if we open up our borders and we do business together and we tackle all these issues that are so pertinent and important to us. And so a common language would certainly help, a common understanding and a common drive together. So ladies and gentlemen, that was my take on welcoming you to Tanzania. Please feel free to stay within Dar es Salaam, or if you have some time, you can go either north or you can go south. You're most welcome. Karibuni sana. I wish I could play the video for you for a little bit, just to get a feel for it. It's tunayo. So I'll teach you some Swahili. Are you ready? No? Is it hard? Tanzanians speak with one language about one thing that we want to do very well. And a report that I read, or that I've seen as a headline, says Tanzania is one of the most robust economies. Oh, we're about to get up. So you'll learn the Swahili when I make the salutation. Stand by for it. Can everybody say kazi iendelee? Yeah, let's repeat that once I call it for it. All right, ladies and gentlemen, kindly stand and let's put our hands together as we welcome our chief guest into the hall, His Excellency, the Vice President of the United Republic of Tanzania. Ladies and gentlemen, I can't hear your hands. Thank you. Thank you. Let's take our seats. Karibuni tukae. Please take our seats. Your Excellency, Dr. Philip Isidore Mpango, the Vice President of the United Republic of Tanzania, as you walked in, I was about to teach this august audience a bit of Swahili, the most relevant Swahili they need to know. The words kazi iendelee. The work has to continue. And we repeat that with what has become famous from our beloved President, Dr. Samia Suluhu Hassan, who says, in the name of the United Republic of Tanzania, kwa jina la Jamhuri ya Muungano wa Tanzania, kazi iendelee. And this is very pertinent work that we're doing here today, Your Excellency. I wish to introduce at the high table, His Excellency, retired General Dr. Constantine Chiwenga, Vice President and Minister of Health and Child Care, Republic of Zimbabwe. Please put your hands together and applaud his presence here with us. I am sensitive to gender and it's beautifully balanced at this table, except that it's basically on the left. And so I'll move over to you, Your Excellency, Mama Monica Gengos, First Lady of Namibia. Please be acknowledged. In the room, widely represented in the Alliance, the Honorable Ministers of Health, allow me to acknowledge the presence of the United Republic of Tanzania mainland and Zanzibar ministers Mama Umi Mwalim, and Honorable Nasor Ahmed Mazrui. Tanzania has excellent relations, as we were discussing, with all of your countries. And to represent us ably at the high table is the Deputy Minister, Foreign Affairs in East Africa Cooperation. Please applaud the presence of Maruk Nasur Maruk, please. We're also truly honored to have Winnie Byanyima, UNAIDS Executive Director, present at the high table. Please acknowledge her presence. Karibu sana. Distinguished guests, ladies and gentlemen, karibuni sana. All protocols are observed. Kindly observe our excellencies and honorable ministers when you get your turn to speak. My name is Taji, and I'm happy to be joined by co-host MC, Dr. Catherine Joachim, whom we will share the program, the distinguished program ahead of us. We extend a warm welcome to all of you to the second segment of our meeting today that marks the official launch of the Global Alliance on Ending AIDS in Children. Over the next few minutes, you will have the opportunity to hear commitment statements from the Ministers of Health of allied countries. And I have now the pleasure to set it off to invite the Honorable Umi Mwalim, Minister of Health, United Republic of Tanzania, to deliver her welcome remarks. Your Excellency, Your Honor, please join me at the lectern. Your hands, ladies and gentlemen. Karibu sana.
Asante sana Taji, His Excellency Dr. Philip Isdor Mpango, Vice President of the United Republic of Tanzania, His Excellency Retired General Dr. Constantini Chiwenga, Vice President and Minister of Health and Child Care, Republic of Zimbabwe, Her Excellency Madam Monica Geigos, First Lady of Republic of Namibia, dear colleagues, honorable ministers of health from the Global Alliance to End AIDS in Children and their representative, my dear sister, Winnie Byanyima, UNAIDS Executive Director. I would also like to recognize the presence of Deputy Minister of Foreign Affairs and International Cooperation of the United Republic of Tanzania. I'd like also to acknowledge the presence of Chairperson of the Parliamentary Standing Committee on HIV/AIDS, Mama Fatma Taufiki, representative from the United Nations, representative from the Global Fund, PEPFAR, dear colleagues from the Ministry of Health, United Republic of Tanzania, and the Zanzibar, as well as a representative from President Office, Regional Administration, Local Governments, representative from the Global Fund, PEPFAR, development partners, civil society organization, people living with HIV, distinguished guests, ladies and gentlemen, habari za mchana. Habari za mchana. Good afternoon. Your Excellencies, ladies and gentlemen, first of all, I'd like to thank His Excellency Dr. Philip Isdor Mpango, the Vice President of the United Republic of Tanzania, for accepting our invitation to officiate this important launch of the Global Alliance to End AIDS in Children. Tunakushukuru sana Mheshimiwa Makamu wa Rais. We know that as a father, husband, and a grandfather, promoting mother and child health has been a passion, including ending HIV/AIDS in children. Asante sana Mheshimiwa Makamu wa Rais kwa muda wako. I would also like to thank my dear sister, Executive Director of UNAIDS, Dada Winnie. Now I have to call you Dada because Uganda is just close to Tanzania. Dada Winnie Byanyima, for trusting Tanzania to host this important alliance, to host this important launch of the Global Alliance to End HIV/AIDS in Children. Tanzania is very proud to host this important strategic initiative. His Excellency, the guest of honor, the alliance consists of 12 countries: Angola, Cameroon, Cote d'Ivoire, Democratic Republic of Congo, Kenya, Mozambique, Nigeria, South Africa, Uganda, Tanzania, Zambia, and Zimbabwe, and Namibia is an observer. And we all agree that we need to end AIDS among children by 2030. We need to commit ourselves to the implementation of evidence-based plans to achieve this goal. As Ministers of Health of the Global Alliance to End HIV/AIDS in Children, the mother and child health is a top priority. We are determined to reduce all causes of maternal and child mortality and morbidity in our respective countries. The Alliance provides an opportunity to revitalize our commitment to this priority. Your Excellency, the Vice President of the United Republic of Tanzania, I'm very pleased to inform you that Tanzania is the first country to join the Alliance. When I visited my dear sister in Geneva, May 2022, she told me about this important alliance, and she asked me whether Tanzania is ready to be part of the alliance, and then I didn't resist. I said, yes, we are going to be the first country to join the Global Alliance to End AIDS in Children. And I would like to thank you through you, Your Excellency, the Vice President, Her Excellency, Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, for blessing us to join this Global Alliance to End HIV/AIDS in Children. Honorable colleagues, Ministers of Health, I consider myself to be a very lucky minister, having worked with a president who is a woman, a female. Promoting maternal and child health has been a top priority for the President Samia since she was the Vice President of Tanzania. So whenever I have a problem on maternal and child health, my president is ready to support me. So I'm very lucky, to be honest. I think you should envy me. So thank you very much, Your Excellency, for blessing us to host this important event. But Tanzania is also commending this strategic initiative to end AIDS in children. The strategy aligns with our National Development Vision 2025 and the National 5 Years Development Plan 2021, 2025, 26. Our Health Sector Strategic Plan 5, 2022, 2025, Health Sector HIV Strategic Plan. And these strategies have identified children and young women that are not adequately covered with lifelong HIV treatment, and children are still born with HIV, despite the availability of technology and modalities to prevent this. Tanzania is also targeting to reduce the rate of mother-to-child transmission of HIV to less than 4% by 2025, and to eliminate HIV, syphilis, and viral hepatitis B by 2030. We are looking at increasing the coverage of ART among children to 95%, as well as achieving viral load suppression of 95% by 2025. Your Excellencies, ladies and gentlemen, I'm pleased to inform you that member countries for the Global Alliance to End HIV/AIDS in Children have been preparing action plans to take forward this strategic initiative since the decision was made by UNAIDS in May 2022. These action plans were produced through consultations among all stakeholders, ranging from government, civil society, women and young people living with HIV, and development partners. Yesterday, the technical teams from the 12 countries had peer discussions. We would like to recognize the presence of technical experts from the Republic of Namibia also for participating in this 2 days meeting. Your Excellencies, ladies and gentlemen, later you will witness the ministers or their representative from 12 countries committing to implement the priorities outlined in the Global Alliance to Eliminate HIV/AIDS in Children by 2030 framework. Once again, let me thank you all for attending this important political launch of the Global Alliance to End HIV/AIDS. I'd also like once again to thank UNAIDS for trusting Tanzania to host this important event. Also, allow me to thank the Global Alliance initiative partners and our development partners for their participation and commitment to end AIDS in children. I'd also like to thank our partners, especially the Global Fund, PEPFAR, civil society organization, faith-based organization, for attending this meeting, but also for their commitment and support in our efforts to end HIV/AIDS in children. Having said that, thank you very much for listening. Asanteni sana.
Thank you very much, Honorable Minister. It's now my great pleasure, Your Excellencies, Honorable Ministers, distinguished ladies and gentlemen, to welcome remarks from women and children living with HIV, Mama Leticia Morris, from the National Council of People Living with HIV. May I welcome you to the lectern with honor and your hands, ladies and gentlemen. Karibu sana, Mama Leticia. Please prepare for the message from the Cote d'Ivoire after this.
Habarini za mchana. Mheshimiwa mgeni rasmi, Dr. Philip Isdori Mpango, Makamu wa Rais wa Jamhuri ya Muungano wa Tanzania. Mheshimiwa Makamu wa Rais wa Zimbabwe, Dr. Constantine Chiwenga. Mheshimiwa mama yetu kipenzi, Wayne Byanyima, mkurugenzi mtendaji wa UNAIDS. Waheshimiwa viongozi wote meza kuu, wageni waalikwa, mabibi na mabwana, itifaki imezingatiwa. Mheshimiwa mgeni rasmi, ninayo furaha kubwa kuungana na wenzangu waliotangulia kuwakaribisha nyote katika uzinduzi wa muungano wa kimataifa wa kutokomeza virusi vya ukimwi kwa watoto katika ukanda wetu wa Afrika. Mheshimiwa mgeni rasmi, wasichana balehe na wanawake vijana wameathiriwa kwa kiwango kikubwa ikilinganishwa na wenzao wa kiume. Kuongezeka kwa kasi kwa maambukizi mapya hasa miongoni mwa wasichana na wanawake vijana kunaongezeka hatari ya kuwa na idadi kubwa ya watoto wanaozaliwa na VVU, ikiwa afua za kuzuia maambukizi ya VVU kutoka kwa mama kwenda kwa mtoto hazitatekelezwa ipasavyo. Ili kutokomeza maambukizi mapya ya VVU kwa miongoni mwa watoto, vijana balehe na akina mama, ni lazima tushughulikie ipasavyo ukosefu wa usawa wa kijinsia unaosababisha hatari kubwa miongoni mwa wasichana balehe na wanawake. Tunapaswa kuwa na usawa katika matibabu kwa kufikia makundi yote bila ubaguzi, bila kumwacha nyuma yeyote, na toa rai kwa wanaume na wanajamii kwa ujumla kuunga mkono juhudi hizi, hasa kupinga unyanyapaa kwa VVU ili kuepuka kurudisha nyuma juhudi za muungano huu wa kimataifa. Mheshimiwa mgeni rasmi, kupitia muungano huu ni muhimu kuwa na ushirikiano madhubuti na wa kimkakati ili kusaidia kutokomeza ukimwi ifikapo mwaka 2030. Hii linawezekana kufanyika kwa ushirikiano imara na wa kimkakati na wadau mbalimbali wakiwemo sekta binafsi, serikali na viongozi wa dini. Mfumo wa wajibikaji wa pande zote na uhamasishaji wa upatikanaji wa rasilimali watu na fedha ili kuharakisha kutokomeza VVU kwa watoto na kufikia lengo la kimataifa la kutokomeza ukimwi ifikapo 2030. Mheshimiwa mgeni rasmi, VVU tuko mstari wa mbele kusaidia kufikia wenzetu wanaoishi na virusi vya ukimwi. Juhudi zetu zinalenga sekta zote na kwa kiwango kikubwa zimechangia kubakiza VVU wengi zaidi katika matibabu ili kuweza kufikia malengo ya 95. Vilevile tumejikita katika kupunguza changamoto za kiuchumi miongoni mwa vijana na wanawake wa VVU na wasio wa VVU ili kupunguza hatari ya kuambukizwa VVU kwa vijana balehe, akina mama na hatimaye watoto. Sisi kama wa VVU tumejikita katika ujasiriamali, ndio maana tunajiunga katika vikundi wezeshi vya VVU tukijazilishana ili kuepuka utegemezi. Mheshimiwa mgeni rasmi, mwisho ninaomba wadau wote tushirikiane kwa kuweka mikakati maalum katika kubuni na kufadhili afua mbalimbali za VVU katika kila nguzo ya mpango huu, kuanzia upimaji wa VVU, kuziba pengo la matibabu miongoni mwa makundi yote, kuzuia maambukizi mapya na kushughulikia changamoto za usawa wa kijinsia na ubaguzi kwa makundi maalum. Watu tunaoishi na virusi vya ukimwi tuko tayari kufanya kazi nanyi katika kuimarisha muungano huu na kuwezesha ushirikishwaji wa kimataifa na wa WAVIU ili kufikia malengo ya muungano huu. Naitwa Leticia Morris Kapela, ninaishi na maambukizi takribani miaka 26, ni mama mwenye familia ya watoto 6 na wote wako salama. Ninamshukuru Mungu, ninampenda Mungu, nawapenda watoto wote wa Tanzania na Afrika, najipenda pia na najikubali. Asanteni kwa kunisikiliza.
All right, please let's put our hands together once again for Mama Leticia. And I did not really have a minute as I was rushing here and there to set things right, but she notes that adolescent young girls have been the most affected when compared with their counterparts, the male counterparts, and they increase in infections amongst girls, is also impacting women who are bearing children with the infections from HIV. And so she believes that it's very important that all efforts should be made, and that's why we're here meeting to decrease the chances of mothers bearing children with HIV. She notes that it's important to address the gender disparities in society. She believes that our cooperation through the alliance is crucial, and it should be strategic in order to combat HIV and AIDS. It's an ambitious target. 2030 is not too far away, but together we can. On behalf of people living with HIV and AIDS, they stand in the front lines to cooperate and assist in any possible way. Those people living with HIV and AIDS, they will continue putting as much effort as they can, efforts that address the policy issues across the sectors as best as they can. And she assures us within Tanzania, and hopefully this message can be carried across the allied countries, that people living with HIV and AIDS will stand at the front lines and adhere to all the medications and all the treatments that are available to them, so that we can reach the desired goals of the 95, 95, 95. Ladies and gentlemen, in short, allow me to address a couple of points that I've quickly read from Leticia's speech, and let's put our hands together once again. My co-MC, please join me on stage as we proceed now to Côte d'Ivoire. I believe the video is ready. I checked, and we can connect directly. Hello. You may proceed, and you
Oui.
have about 3 minutes, Your Excellency.
Bonjour. OK. J'espère que vous m'entendez. Vous m'entendez?
We can hear you. I speak a bit of French.
Yes.
Are you going to be delivering this in French or in English?
In French, in French.
Yes, we can.
In French.
OK. Excellence, Monsieur le vice-président de la République de Tanzanie, Mesdames et Messieurs les ministres, honorables invités, distingués participants, Mesdames et Messieurs, je suis heureux de vous adresser le message de la Côte d'Ivoire pour mettre fin, donc, dans le cadre de l'Alliance mondiale, au VIH/SIDA chez les enfants d'ici 2030. En Côte d'Ivoire, au 31 décembre 2021, notre pays a enregistré une couverture en traitement ARV de la prévention de la transmission mère-enfant chez les mères de 95% et un taux donc de transmission du VIH/SIDA de la mère à l'enfant de 6%. Le nombre de nouvelles infections chez les enfants, les adolescents et les jeunes a baissé de 83% et de 115% respectivement pour les 0 à 14 ans et les 15 à 24 ans comparés à l'année 2010. Le nombre de décès est également en baisse par rapport à 2010. Il a varié de 87% et de 37% respectivement chez les enfants de 0 à 14 ans et de 15 à 24 ans. Donc, au regard des objectifs des 3 fois 95, la Côte d'Ivoire enregistre les chiffres de 58, 93 et 111, la plaçant parmi les pays avec les meilleurs résultats dans la région africaine, ouest africaine et centrale. Malgré ces résultats encourageants, il convient de reconnaître que des efforts importants restent à faire pour atteindre les objectifs d'élimination. Cette raison justifie notre engagement dans l'Alliance pour l'élimination du sida chez les enfants d'ici 2030. En effet, si la prévention de la transmission mère-enfant connaît une évolution satisfaisante, force est de reconnaître que l'identification des enfants infectés et leur mise sous traitement avec l'observance constituent des défis que nous devons relever. En fin 2021, seulement 61% des enfants exposés au VIH/SIDA ont bénéficié d'un dépistage précoce. La cascade des 3 fois 95 était respectivement de 58, 54 et 38%. Ces résultats sont relativement faibles comparés à ceux observés chez les adultes. Face à cette situation, la Côte d'Ivoire réaffirme donc son engagement prioritaire à réduire le taux de mortalité néonatale, infantile, infanto-juvénile et maternelle d'ici 2025. Il réaffirme son engagement à créer un environnement favorable pour la lutte contre toutes les formes de stigmatisation et de discrimination et les atteintes des droits humains pour les personnes vivant donc, avec le VIH/SIDA, en particulier chez les femmes, les enfants et les adolescents, à travers la révision du cadre juridique et leur application effective. D'autre part, le pays s'engage sur les 3 prochaines années pour des actions spécifiques suivantes. Mettre en œuvre à tous les niveaux de la pyramide sanitaire la triple élimination de la transmission mère-enfant, du VIH/SIDA, de la syphilis et de l'hépatite B, ainsi que de la tuberculose pédiatrique. Diagnostiquer 95% des enfants exposés au VIH/SIDA à l'âge de 2 mois. Organiser annuellement à Abidjan un colloque international sur la prise en charge pédiatrique du VIH/SIDA et les PTME pour renforcer le cadre de partage régional des bonnes pratiques, des innovations et des avancées scientifiques sur la réponse au sida pédiatrique. Excellence, Madame la Présidente, Mesdames et Messieurs, au terme de mon intervention, nous voulions vous assurer de l'engagement de la Côte d'Ivoire à mettre fin au VIH/SIDA chez les enfants d'ici 2030. Je vous remercie.
All right, well, thank you very much for your remarks and for also observing time. May I proceed by calling the next speaker, and Your Excellencies, distinguished ministers, ladies and gentlemen, we're now going to hear commitment statements from Ministers of Health of Alliance countries. It's my great pleasure to welcome the Honorable Dr. Nakumicha Susan Wafula, Minister of Health, Kenya. With your hands, ladies and gentlemen. The State Minister of Uganda, please stand by. You are next.
Thank you very much. Your Excellency, Hon Dr. Philip Mpango, the Vice President of Republic of Tanzania, His Excellency Vice President and Minister for Health, Hon Dr. Constantine GDN Chiwenga, Zimbabwe, Her Excellency Monica, the First Lady of the Republic of Namibia, Honorable Umi Mwalimu, Minister of Health Tanzania, who is our host, Mrs. Winnie Binyanyima, UNAIDS Executive Director and Under-Secretary General of the UN and other partner representatives, my colleague health ministers present, community representatives, all protocols observed. Receive warm greetings from His Excellency the President of the Republic of Kenya, Honorable Dr. William Samoei Ruto, and the great people of the Republic of Kenya. I am delighted to be in Tanzania today as we take bold steps to achieve an ambitious goal of ending AIDS in children by 2030. We are represented with an opportunity to remove technical and structural barriers that deny children an AIDS-free start, a better chance to survive, thrive, and fulfill their dreams. The impact of this initiative will reignite powerful ripples of hope across member nations and the world. Kenya acknowledges the power of the model global partnerships, including PEPFAR, Global Fund, and communities. And on this, allow me to congratulate our partner PEPFAR for the 20 years of unrelenting support to Kenya and many other countries in responding to HIV that have yielded undeniable results. Through partnerships over the last 10 years, Kenya reduced new infections by 57%, and AIDS-related death decreased by 68%. We are, however, still faced with challenge of a high HIV burden, with 65% of the 1.4 million living with HIV being women of childbearing age, and new infections among children, adolescents, and young people coupled with HIV-related mortality. Mother-to-child transmission rate remains high at 8.9%. Treatment outcomes for children living with HIV also remain suboptimal, with about 78% of those on treatment virally suppressed compared to 88% of adults. Children have been left behind and their voice remain unheard. Kenya is committed to continuously examine such glaring gaps to grow our resolve to end AIDS in children. Specifically, within the next 3 years, as members of the Alliance, Kenya will implement a 4-point action plan to bridge the gaps and fast-track the progress of ending pediatric AIDS by 2030. Our action point, number 1, is to address vulnerabilities and inequalities that sustain the new infections and impede progress by subpopulations and geography. We shall do this by providing policy direction for prioritized, targeted actions to bridge programmatic gaps across all geographical locations and subpopulations that are left behind. We shall also strengthen and leverage and bring to scale accelerated, multi-sector, accountable actions across all governments to address the triad challenge of new HIV infections, pregnancies, sexual and gender-based violence facing our young people. We will advocate for inclusion of benefits for vulnerable households of children and women living with HIV within social protection, nutritional support, and social health insurance frameworks. We will also invest in community-led peer-to-peer models, such as Mentor Mothers and the robust network of community health workers for psychosocial support. Our action point number 2 is to close all the bottlenecks in diagnostic systems, commodity security, and health workforce. We shall do this by advocating for and provide incremental and ring-fenced domestic resources to assure commodity security for this agenda. We shall also adopt and scale up effective technology and innovations for diagnosis, treatment, and support. We shall capacity build our human resource for health to deliver on this agenda. Our action point number 3 is to renew partnerships and align resources with country priorities and costed work plans. We'll do this by developing a costed national strategic plan towards this agenda to mainstream accountable collaboration with stakeholders. We shall operationalize a national validation committee to sustain sustainability to this agenda. And to this, we shall also create a bottom-up movement on ending AIDS in children in Kenya, roll out a campaign in the Republic of Kenya across the 47 counties with citizens at the core of planning and implementation. And our last action point number 4 is prioritize data and information system to have an informed, science-led response at all levels. We are in the process of digitalization of our health services in the country. We shall also do an investment in use of local community social intelligence to build a sustainable response. We shall operationalize a unique identifier, secure accountability and fidelity in access of quality service. And for that, we are already ahead of it. And in the next few months, we shall be rolling out our unique identifier. Your Excellencies, ladies and gentlemen, the Kenya government, under the leadership of His Excellency, our President, Dr. William Samoei Ruto, has prioritized universal health coverage and more remarkably identified ending AIDS as a key priority. Additionally, our approach, popularly known as Hustler Movement, gives emphasis on defending the weak through a bottom-up approach. In this approach, we believe in working from the grassroots, by grassroots for grassroots, the marginalized, the weak, and the voiceless. The agenda of ending AIDS in children will require this approach that recognizes the power of citizens to create and be part of the change that we want. To this end, through the support of Global Fund and other partners, we are starting a countrywide rapid result initiative to bridge the gaps and accelerate progress in ending AIDS among children. The initiative aims to mobilize citizens and professionals at all levels to see the urgency of this agenda. I assure the duty bearers, including partners of Kenya, prioritization and commitment to, one, end pediatric AIDS by 2030 by implementing the action plan with the support of partners and donors. I assure bearers and partners also that we shall track and report progress to the Alliance. I also assure you that we shall allocate domestic resources where needed to fill critical gaps, in particular to support health systems, including commodities and information and system. Ladies and gentlemen, let's put our act together and move from talk to action. And I believe together in action, we shall end AIDS in children by 2030. Thank you very much.
Thank you, Your Honor. It's my pleasure to now welcome the State Minister from Uganda, Honorable Margaret Mohanga. Your hands, ladies and gentlemen. Please.
Your Excellency, the Vice President of the Republic of Tanzania, Your Excellency, the Vice President of Zimbabwe, the Honorable Ministers of Health here present, the United Nations representatives here, the PAPFA representatives, AIDS involvement partners, and all distinguished ladies and gentlemen, good afternoon. It is with pleasure for me to stand before you today to launch this global alliance to end AIDS in children by 2030. I want to thank the President of Tanzania, who is not here with us, for hosting this important event. I want to appreciate the United Nations family and the entire organizing committee for their effort in bringing us together for this noble cause. For over a decade, Uganda has been working tirelessly to end AIDS among children through prevention of mother-to-child transmission, early identification and treatment of children living with HIV, and also the support and care that we give. Despite all this, we have not yet achieved our goals of eliminating AIDS as a public health problem among children. We do face challenges such as inadequate retention of pregnant and breastfeeding women in care, leading to new infections among children, suboptimal case identification, and viral load suppression among children. To address this, the Global Alliance is timely and necessary. Uganda is committed to its implementation and has formed a technical working group to oversee the progress. And to this end, we are working closely with the stakeholders to accelerate progress and eliminate vertical transmission of HIV and AIDS. Uganda has also integrated the PAP for accelerated progress in PMTC and pediatric and the AP3 initiative with a Global Alliance plans to form national action plan to end AIDS in children by 2030. Uganda's focus will be on scaling up efforts at the community level, working closely with networks of people living with HIV. The civil society organizations will not be left behind as well. We will regularly be monitoring progress through the established monitoring and evaluation frameworks and accountability meetings. Priority will be given to the high burden and high prevalence regions with sustained efforts in the remaining regions. Our approach will also be multi-sectoral to provide holistic support to our clients. I would like to take this opportunity to thank the Ugandan technical team, the technical working team on this initiative, and also to appreciate the stakeholders. And I believe together we can fight AIDS among children by 2030, and we end it. As I conclude, I want to emphasize that Uganda is committed to ending AIDS in children by 2030 and is being part of the new and great initiative. We are committed to funding key priority and high impact interventions in our national action plan. We are also committed to tracking our progress to ensure that we remain focused to our objectives as laid down in the National Action Plan. I thank you for your kind attention. Asanteni sana.
Thank you very much, Honorable Margaret Mohango, for the commitments from Uganda. Your Excellencies, Honorable Ministers, ladies and gentlemen, I would like to apologize, would have to invite the Minister of Health for Zambia to give his commitments virtually. I request the studio to put online Honorable Minister for Health of Zambia, Honorable Sylvia Tembo.
Honorable Minister, may I request you to please unmute and turn on the camera. Thank you. Minister, may I request you to please turn on the camera.
Sorry, we are in the meeting currently.
All right, so we might have a slight glitch. It shouldn't hold us back. We can get right back to them. Those were remarks from the Executive Director, UNICEF. Allow me to welcome in person community leadership. The title for the next presentation holds the key to impact. Remarks from the global networks. Lillian Moreko on behalf of ICRC ICW, Y Plus Global, and GNP Plus. Ladies and gentlemen, your hands, please. We'll retry the reconnection. Please remotely request for them to unmute so that we can proceed with it after the following remarks from Lillian. Karibu sana, ma'am. We are kindly requesting that we stick to our 3 minutes respectfully.
Our guest of honor, the Vice President from Zimbabwe, all our ministers present, Honorable Winnie Byanyima, representing the UN family, ladies, gentlemen, and others. I bring you greetings from the community of people living with HIV. Ladies, gentlemen, and others, and our guests of honor, it is possible and within reach to end AIDS in children by 2030. Today, the 12 countries here have recommitted. We recommend that countries focus on the following in addition to their commitments: integration of community-based prevention of mother-to-child transmission, improving early diagnosis coverage through early infant diagnosis with a focus on point-of-care testing, improving access through optimizing point-of-care testing, increasing investment in partnerships to allow institutionalizing innovation and best practices. The partnership should cascade to community-led organizations. Our chief guest, many speakers have highlighted the statistics. As communities and leaders and women and mothers living with HIV, we know the faces and feel the urgency in ensuring that children are no longer failed by the AIDS response. Today, again, on behalf of people living with HIV, I want to reaffirm the commitment of us as people living with HIV, but also as recipients of care and mothers and parents to the children that we are losing out of care, but also the children that are getting infected on a daily basis. We have helped to shape the alliance and ensure that human rights, community engagement, and gender equality are part of the pillars of the Global Alliance. Yesterday, our guest of honor, as communities of people living with HIV and civil society, we shared the priority checklist from communities, and we are glad that so many of you present here found it useful for your national action plans. We continue to commit to continue to partner with you to mobilize our communities and contribute our expertise to help us achieve the goal. As we all go back to our countries, we ask you to take the spirit of DA and partner with us. We believe a women-led response is key in ending AIDS in children. The principles for what community leadership will include that we believe is going to help us end AIDS among children requires that we fully engage the unique assets of communities, capacities, comparative advantage of communities, including women-led organizations, youth-led, key population-led, and people living with HIV-led to drive meaningful person-centered impact. But we also believe that the carers, the healthcare workers must be put into the center if we have to get where we want to get. This calls for leadership at all levels. We have to better integrate community voices. We have to center equity and ensure that most vulnerable and the underrepresented are well positioned. Importantly, but not least, youth leadership is very critical.
We must elevate the leadership capacities of youth-focused organizations. And our guest of honor, as I end, before you came, I had talked to this August House and told them that about 14 years ago, when we had less tools, when we had less resources, when we were not empowered as we were, I was able to deliver a child who is negative. 3 years later, I delivered another one. The resource that we have today, our guest of honor, we did not have then, but we were able to do this. And therefore, our call to action is, let's be part of the team that is going to end AIDS among children. And as women living with HIV, we believe that we are better placed to do that because we are the ones who deliver these children. We are the ones who take care of these children to the extent that even when they don't adhere to treatment, we know why and we know where they are. And therefore, our call to the 12 countries and others to come into your guest of honor is that let's shout out, let's call to action, let's do what Kenya has told us, the bottom-up approach, so that we are able to address the problem from where it comes from. Thank you very much.
Well, thank you for those hands to Mama Lillian. Honorable guest of honor, for the terrible translation that I did for the chairman, Leticia Morris of the National Council of People Living with HIV and AIDS here in Tanzania. May I please directly refer to the speech that you've heard right now, being a great reflection of the same sentiments that were carried for both. Please put your hands together for them. Now we can move to Zambia. We have a connection right now, and it's great to hear from you, Honorable Sylvia Tembo Masebo. Karibu sana.
Thank you.
Please proceed.
Thank you and good afternoon. Your Excellency, Vice President of the United Republic of Tanzania, Dr. Philip Mpango. Your Excellency, Vice President of the Republic of Zimbabwe and Minister of Health, Retired General Honorable Dr. Constantine GDN Chiranga. Your Excellency, Mama Monica Giggons, the First Lady of Namibia and Chair of the Organization of African First Ladies on AIDS and Development, Minister of Health, United Republic of Tanzania, Honorable Umi Mwalimu, Honorable Ministers of Health present, UNAIDS Executive Director and Under Secretary General of the UN, Ms. Winnie Yanyima, the United States Global AIDS Coordinator, Ambassador Dr. John Kengeson, WHO Director General, Dr. Tedros, representatives of the Global Fund, representatives of UNICEF, parliamentarians present, representatives of people living with HIV, various civil society organizations, members of diplomatic missions present, all protocols observed. Allow me to state from the outset our deepest sense of gratitude to be invited to this political launch of the Global Alliance to End AIDS in Children by 2030. My two dear sisters, the UNAIDS Executive Director, Madam Winnie, and my fellow Minister of Health for the United Republic of Tanzania, Madam Mwalimu, I say thank you for inviting me and my team. I would have loved to be there in person, but due to other equally important pressing issues here back home, I've been unable to join you physically. The Republic of Zambia is pleased to be a proud partner under the Global Alliance to End AIDS in Children by 2030. We are therefore pleased to be working with UNAIDS, UNICEF, WHO, PEMFAR, the Global Fund, civil society organizations, and communities of people living with HIV. We realize that to achieve this, we need to pay particular attention to women living with HIV and populations at increased risk of HIV infection, including adolescent girls and young women and key populations. Your Excellencies, distinguished guests, ladies and gentlemen, we are more than ever committed to ending AIDS in children by 2030 in Zambia. And our commitment to achieve this is through a decentralized service delivery model, which we have embarked on under this administration, led by His Excellency, the President of the Republic of Zambia, Mr. Hakainde Hichilema. Responses to childhood AIDS have been treated as special types of interventions offered by a few specialized health workers. We are committed to using the following: 1, sub-national levels; 2, the private sector; 3, our traditional and religious leaders; 4, civic leaders; 5, the media; and 6, academia, then research institutions, and above all, the community through civil societies to promote all aspects of childhood AIDS responses. Using the local government model, we will increase domestic resource financing in all the constituencies of our country using a special fund that has been instituted called the Constituency Development Fund. This fund will also support the free education policy introduced in this government so as to keep and retain our children in schools, thereby preventing them from acquiring HIV. With the decentralized health system, we will bring issues pertaining to childhood AIDS to the community as part of primary health care. In addition, working with line ministries, Zambia will advance education, promote employment, and income-generating activities for women living with HIV, and expand access to the national social protection systems. Therefore, Zambia affirms its commitment to end pediatric AIDS by 2030 by implementing the following through a decentralized approach. 1, case finding of children, adolescents, and women through a multi-modality testing. Zambia will implement multiple testing strategies, including scaling up the use of point-of-care technologies to remote areas. This will result in improving early infant diagnosis coverage to 95% by 2025. We will also aim to reduce turnaround time for results, leveraging on the health decentralization agenda, which this government has embarked on. Zambia will strengthen and improve the retesting of negative pregnant and breastfeeding women from less than 30% to 50% by 2025. This will improve detection of new HIV infections among pregnant and breastfeeding women. This will further facilitate early intervention to prevent mother-to-child transmission of HIV and early identification of HIV-exposed children. Secondly, optimizing antiretroviral treatment coverage and retention of children, adolescents, and pregnant and breastfeeding women living with HIV. Zambia will ensure commodity security for prevention of mother-to-child transmission of HIV and pediatric HIV services. We will also implement differentiated service delivery for children and adolescents, and further scale up and sustain peer adolescent and mother support strategies. Thirdly, improving knowledge and access to HIV prevention for pregnant and breastfeeding adolescents and women. Zambia will strengthen prevention services at site level by decentralizing dispensing points beyond ART clinics. Zambia will continue capacity building of staff for effective risk identification and management of intimate partner violence, be stigma reduction, C, assisted partner notification, and D, improving prevention coverage among pregnant and breastfeeding mothers. Zambia will prioritize availability of HIV prevention commodities for pregnant and breastfeeding women, including condom plus oral and long-acting injectable ARVs for HIV prevention. I thank you.
Honorable Masebo, thank you very much for your statement from Zambia brought to us virtually. We now may proceed. Are we able now to watch the video from Catherine Russell, UNICEF? If we could get that going, that would be great. Otherwise, may I please, yes, we have Catherine on video. Ladies and gentlemen, your attention and your eyes on the screens. Please play. Please restart with audio. Honorable Sylvia Lutukuta, Minister of Health, Angola, please stand by.
Excellencies, colleagues, on behalf of UNICEF, thank you for coming together in Dar es Salaam to support the Global Alliance to End AIDS in Children. The work of the Alliance to provide treatment to children living with HIV is critical, especially with 300 children dying each day from AIDS. We have a long road ahead. Progress in HIV prevention and treatment for children has nearly flatlined. Today, only half of children and adolescents living with HIV are receiving treatment, compared with 3/4 of adults. Unless this inequity is addressed, ending AIDS in children will remain a distant dream. And it will take all of us in the Alliance, governments, communities living with HIV, donors like PEPFAR and the Global Fund, and UN partners to reach the 1.2 million children living with HIV who are not yet in treatment. But we can do it, and UNICEF will be there every step of the way. Governments and partners can count on UNICEF's continued support. This includes work to integrate HIV services into primary health care and strengthen the capacity of local health systems. And to our community partners, especially women living with HIV, I salute you for your courage and your tireless efforts. UNICEF is here to support you and to advocate with you. Progress is possible. Together we can end the inequity in children's access to HIV prevention, treatment, and care services. Together we can end AIDS in children by 2030.
All right. Thank you very much. Let's interject that with a statement from the Honorable Sylvia Paula Valentim Lutukuta, Minister of Health, Angola. Ladies and gentlemen, karibu sana. Please prepare the video for Dr. Tshidi, the Africa Director, WHO, please.
Excelência, Senhor Vice-Presidente da República Unida da Tanzânia, Dr. Philip Spango, Excelência Vice-Presidente da República do Zimbábue, Dr. Constantino Chiwenga, Excelência Ministra da Saúde da República da Tanzânia, Doutora Uni Walimo, Excelência Primeira-Dama da República da Namíbia e Presidente da OFLAD, Madame Mônica Jengos, Excelências, Senhores Ministros, Ministras, representantes dos ministérios, muito dignos responsáveis das agências das Nações Unidas, todo o protocolo observado. Permitam-me, pois, que felicite Sua Excelência, Ministra da Saúde da República Unida da Tanzânia, pela feliz iniciativa de juntar os 12 países africanos participantes na Aliança Global, mulheres que vivem com VIH, doadores e parceiros de desenvolvimento para falarmos de estratégia para acabar com o SIDA em crianças nos próximos 3 anos. Angola adotou a declaração política aprovada na última reunião de alto nível da Assembleia Geral das Nações Unidas sobre o SIDA. Sob a liderança de Sua Excelência, Presidente João Lourenço, o governo de Angola e o seu povo estão empenhados em alcançar a meta de acabar com o SIDA em crianças como uma prioridade nacional. A campanha Nascer Livre para Brilhar, liderada por Sua Excelência a Primeira-Dama Ana Dias Lourenço, tem sido crucial para o alcance das metas e para os avanços registrados nos últimos anos. Apesar do nosso país estar a sofrer desde 2015 com as consequências da última crise econômica mundial, agravada pela Covid-19, o governo da República de Angola, desde 2016, por ser classificado como um país de média renda, sustenta quase na íntegra os custos com os medicamentos e insumos em mais de 80%. Importa salientar que menos de 20% é suportado pelo Fundo Global em apenas 2 das 18 províncias. Reconhecemos que o financiamento nacional para a saúde ainda não é suficiente para inúmeros desafios da assistência técnica e dos custos, particularmente para as intervenções comunitárias. Assim sendo, gostaríamos de contar com o apoio financeiro dos principais doadores, cá representados, para que possamos atingir as metas dos 95, 95, 95 preconizadas. Porém, registramos uma redução de 42% na taxa de transmissão de VIH de mãe para filho. Em 2018 era estimada em 26% e em 2021, 15%, uma redução de 28% em novas infecções entre adolescentes e mulheres jovens, uma redução da mortalidade por SIDA e um aumento de 41% na cobertura de tratamento antirretroviral. O número estimado de crianças que vivem com VIH em Angola é de 36 mil, segundo o último relatório global da ONU-SIDA, divulgado em 2022. A prevalência nacional é de 2%. Reafirmamos que estamos comprometidos com os esforços globais, regionais e nacionais em curso para alcançar o acesso universal e acabar com o SIDA em crianças até 2030. Não gostaríamos de terminar sem referir que, depois de todo o trabalho realizado pelas equipas técnicas, reiteramos o nosso compromisso para a adoção da Declaração de Dar es Salaam para acabar com o SIDA em crianças em 2030. No que toca às prioridades de Angola, neste primeiro ano, destacamos o Pilar 1, intensificação da busca ativa de casos de crianças expostas para o diagnóstico, tratamento e cuidados na comunidade com engajamento das mulheres que vivem com VIH. No Pilar 2, fortalecimento das intervenções comunitárias lideradas por mulheres que vivem com VIH, promovendo o vínculo das gestantes seropositivas e crianças expostas com as unidades de saúde através de projetos sociais no país, como o Projeto Quenda e de combate à pobreza, para fechar as lacunas do diagnóstico e tratamento. Pilar 3, operacionalização da Comissão Nacional de Luta contra a SIDA e grandes endemias, com vista ao fortalecimento de ações multissetoriais de resposta ao VIH. Pilar 4, mobilização e capacitação das mulheres que vivem com VIH sobre os direitos humanos, a equidade de gênero baseado nos resultados de estudo de caso contra o estigma e discriminação. Juntos, somos mais fortes contra o fim do VIH em crianças em 2030. Agradecemos a vossa atenção. Ashanti.
Thank you. Thank you, Your Honor. May we proceed? Do we have the quick video? And once again, I'm going to request for, are we good? Is that okay, let's go.
Your Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, Excellency Monica Gengos, First Lady of the Republic of Namibia, Honorable Umi Mwalumi, Minister of Health of Tanzania, Honorable Ministers of Health of the Alliance countries, Ambassador Minata Samatesesuma, African Union Commissioner for Health, Humanitarian Affairs and Social Development, Ambassador Dr. John Nkengasong, United States Global AIDS Coordinator and Special Representative for Health Diplomacy, the U.S. President's Emergency Plan for AIDS Relief, Mr. Peter Sands, Executive Director of the Global Fund, my sister, Madam Winnie Byanyima, Executive Director of UNAIDS, Mrs. Catherine Russell, Executive Director, UNICEF, our WHO Director General, Dr. Tedros Adhanom Ghebreyesus, civil society movements and community members, especially people living with HIV, implementing partners, colleagues, brothers and sisters. I wish to express my sincere gratitude to all the partners of the Alliance for this beautiful initiative formed in Montreal, which we are launching today in Dar es Salaam. Having devoted a good part of my career to the fight against HIV/AIDS, the birth of this alliance fills my heart with joy. It's not by chance that today's launch is taking place on African soil. Africa carries more than 80% of the AIDS burden among children. We know that children living with HIV continue to be left behind by the global HIV response. There is low uptake of testing, inadequate treatment coverage, and low retention rates among children. These disparities stall progress for children and lead to poorer treatment outcomes compared to adults. Your Excellency, it's estimated that 800,000 children aged 0 to 14 years living with HIV are not receiving antiretroviral therapy. This is unacceptable because we have the knowledge, capacity, and technology to redress the situation. Point-of-care diagnostics and HIV self-tests are more widely available. We now have treatment options for children that are better tolerated, more effective, and cheaper than ever before. We've less than 8 years to reach the goal of ending AIDS. We must accelerate progress towards addressing the glaring inequalities. It's exciting that the Global Alliance is focusing on children and adolescents living with or exposed to HIV, pregnant and breastfeeding girls, women living with HIV, as well as those at high risk of HIV. Girls are 6 times more likely to be infected with HIV than boys. This is a damning comment on our collective efforts of the past 25 years. Ending AIDS in children must better address the disproportionate burden of health inequities on Africa's girls. The alliance that we are launching today will succeed when we have strong leadership, political commitment and resources globally, but more so at country level. The affected communities must be centrally engaged and participate in the programming, implementation, monitoring of the response. HIV-affected communities have proved themselves. Let's build on that. We must embrace innovation and new technologies that improve access to services, especially in remote areas, in crisis, and in conflict. I urge the Global Alliance member states to commit to ending pediatric AIDS by 2030 by implementing the action plans, track and report on programs to the Alliance, allocate domestic resources where needed to fill critical gaps, including particularly to support community engagement. The sprint echoed in Montreal has begun, but we're not sprinting alone. We are running together, supported by the force of partnerships, our eyes on the 2030 goal. We at the World Health Organization commit to working with you all and providing the policy and technical leadership to this strategic initiative together with our partners, particularly UNICEF and UNAIDS. We look forward to hearing your commitments today, and I thank you very much.
Thank you very much. Guest of honor, Your Excellencies, distinguished ladies and gentlemen, with great respect and with due respect, we're going to alter the program just a little bit so that we can allow our guest of honor in about 30 minutes time to proceed to other pressing engagements as equally important as this one. And so we've deliberated and have come up with the following speakers, and everyone else on the program will continue after his departure. So we'll begin with EGPAF. We'll call Madam Winnie. We'll also call Madam First Lady to speak. Your Excellency, the Vice President of Zimbabwe, you will also have a minute or two to say a couple of words before our host minister welcomes the guest of honor to speak. And of course, she will read her statement as well. We are very limited with time, and so we're going to be requesting for just about a 2.5 minutes, 3 minutes, if we can, courtesy. So from EGPAF, it's my great pleasure to welcome you. Representative Karibu Sana, with your hands, ladies and gentlemen. Chip Lyons, Karibu.
Thank you very much, and good afternoon to everyone. Excellencies, ministers, ambassadors, colleagues, and friends, it is a privilege and an honor for me to speak with you today. In particular, Your Excellency Philip Mpango, Vice President of Tanzania, Your Excellency, Vice President from the Republic of Zimbabwe, the Honorable Dr. Samia Suluhu Hassan. I want to say thank you to each of you, to Madam President, for the commitment to ending AIDS in children, and to thank you for prioritizing this meeting. The importance of your participation really cannot be overstated. That said, I had a rather longer statement to make. I was asked by the organizers to speak to a number of issues, and as we are wont to say here, time is not on our side. So I'm simply going to give my full remarks to the organizers, kind of submitted for the record, and we certainly at EGPAF will be happy to share those remarks. I'm just going to highlight 3 points. I think the majority of colleagues here are aware of EGPAF, the Elizabeth Glaser Pediatric AIDS Foundation. We will be celebrating 35 years since the remarkable leadership of Elizabeth Glaser, 25 of those years on the continent here. We've worked with many of you across all of the countries that are participating. We are here in support of this alliance. We believe the alliance is critically important. The alliance is necessary, it's not sufficient. And so there are a number of other actions that we need to take, and we need, as our program colleagues were challenged yesterday, to think differently. Well, it's not enough for the program colleagues to think differently. I think our advocacy colleagues and ourselves have to think differently. I think we have to speak differently. I think we have to do a number of things more creatively, drawing on the successful actions of the last number of years. Second point is data. So many colleagues have spoken to it. It's essential, particularly since virtually everyone in this room chooses to make data-informed decisions on the one hand, but we have a kind of logic problem. We keep doing surveys that don't include 0 to 14 in the surveys. We want the data, we don't ask for it, we struggle when we have to make adjustments because we didn't get the data, even though we're still collecting. So there are ways to do sustainable and affordable surveys and other actions where we can get the data, including on 0 to 14, so we can make better and smarter decisions. Investments. The next big piece of this whole work is around investments, and yet we don't have nearly as good a picture of where and how investments are being made for children. We don't know nearly enough. Thankfully, SACABA, the Coalition of Children Against for Children Affected by AIDS, has issued a report. It's like a flashlight in the dark, so we can figure out the next steps. Critical to these revised strategies is further investment. We have to be real smart about finite resources that are going to have the greatest impact for children. We need to scale the tools we have, the optimized treatment that we have, pediatric DTG. So much work was done to develop that point of care, early infant diagnosis, enormous amount of work done to prove how effective that is. It's not being scaled, it's stalled, it needs to scale. The executive director, Winnie, made a hugely important comment earlier today. COP process and the CCMs with the Global Fund are just ahead of us. Those are the opportunities to combine the strategies that have been developed, the need for further investments, the need for advocacy, so that the Global Fund clearly hears at the country level a voice for children, and that is all of you, that is all of us collectively. And thank you very much for making that commitment today. Thank you very much.
Thank you, Chip. It's my great pleasure to welcome you, Mama Winnie. Yanyima Karibu. With our hands, ladies and gentlemen, UNAIDS Executive Director and Under Secretary General of the UN.
Thank you very much. Your Excellency, Vice President of the United Republic of Tanzania, Dr. Philip Mpango, Your Excellency, Vice President and Minister of Health of Zimbabwe, Retired General Chiwenga, Your Excellency, my sister, First Lady Monica Gengos of Namibia, also President of the Organization of African First Ladies for Development, my sister, Honorable Umi Mwalimu, Minister of Health of the United Republic of Tanzania, honorable ministers, country representatives of the 12, or government representatives of the 12 countries who have joined the alliance in this first phase, and the delegation, the observer delegation from Namibia, colleagues from the United Nations, partners from PEPFAR Global Fund, EGPAF and others, and friends from civil society, leaders from civil society. Yesterday, I visited the Mbagala Rangitatu Hospital, where I met two amazing women, Salome and Sharifa. They gave birth at this hospital to their HIV positive. They gave birth to HIV negative babies, and they are raising those children on treatment. They are also working as powerful connectors between the hospital and the community. The great news is that Salome and Sharifa, their children are growing up healthy and are going to live long lives, inshallah. The scandal is that we still have 1.7 million children who we adults are denying that same future. That is a scandal. The scandal is that we've found a way to get 3/4 of all adults living with HIV on life-saving treatment, but only half the children who are HIV positive on treatment. That is the scandal. It breaks my heart. We are here to address that injustice. We have come together to support Salome and Sharifa. They are called peer mothers, and so many millions of women who are HIV positive, who want to save their babies. No mother doesn't want to save their baby, like Lydian told us. We are here to support them, to fight, to save the lives of their babies. I'm proud to be part of this momentous occasion of launching this global alliance to end AIDS in children by 2030. I'm so happy to be among you honorable ministers and representatives of the 12 governments, because I know I have been a politician like you. This is a low-hanging fruit. You can win it. You can say, I ended AIDS in children in my country, and we're here to support you. Thank you for all you've done since we met in Montreal, Canada. The action plans, the prioritizing, the partnerships, the coalitions. Thank you for the hard work. But today, thank you for the commitments to make sure that infants, children, adolescents at risk for HIV are tested, to guarantee the best treatments and care for those who test positive, to close the treatment gap for pregnant and breastfeeding adolescent girls and women living with HIV, and to protect, to prevent and detect new infections among women and girls. But also, strongly in addition, we've heard how critical it is to address human rights, gender equality, and social and structural barriers. So this is about getting the whole of government into this agenda. Thank you for committing to do that too. We also heard, and we will hear, more commitments from global leaders to support your governments and your people to implement these plans. It is through partnerships that we have made the progress against HIV. It is through these partnerships that we can get to the end of this fight. It's a winnable fight. It's a fight for our children, watoto wetu. It fills me with hope that all of us in this room have committed. Here is our commitment on behalf of the United Nations. We commit to support the implementation of the Dar es Salaam Statement of Action, all of us at the United Nations, co-led by WHO and UNICEF. Together we can create that world where no child is born with HIV. Countries have achieved it. These 12 can achieve it too. No child living with HIV is denied their right to life-saving treatment. We can do this. Thank you very much.
Powerful message. It allows me to welcome you, Your Excellency, Mama Monica Gengos, First Lady of the Republic of Namibia, for your very brief statement, unfortunately, and respectfully, once again. Ladies and gentlemen, if you put your hands together, karibu sana.
Thank you, Director of Ceremonies. Your Excellency, Dr. Philip Mpango, Vice President of the United Republic of Tanzania. Your Excellency, Retired General Dr. Constantine Chiwenge, Vice President and Minister of Health and Childcare of the Republic of Zimbabwe. Our host, Minister of Health, Honorable Umi Mwalimu, and your counterparts from other African countries, thank you very much for your very powerful statements and commitments that you've made earlier. Winnie Banyima, the Executive Director of UNAIDS, I'll try and be as brief as I can. I stand here on behalf of the Organization of African First Ladies, because we've always been engaged in ending AIDS on the African continent. We, as recently as 2018, we ran a continent-wide campaign called the Free to Shine campaign, where we partnered with UN agencies, where we focused on pediatric HIV. We will be doing something similar this year. And we've done this in partnership with UNAIDS. And I'd really like to thank Winnie, I think, for her forthright leadership, and through you, all the UN agencies and the ministers of health who are present here today. There are a lot of issues that face African youth. And ending HIV is not and should not be one of them. The solutions are clear. We know what has to be done, and it's really the political will and political action that we need to harness. And I think we've seen that through the ministers of health who've spoken here today. We also have to reflect on a few things. And it's appropriate at this forum to reflect on our attitudes, religious beliefs, cultural practices, and how we've shaped masculinities. We cannot speak about preventing and treating HIV if we cannot speak about sex. And if our religious beliefs and cultural practices have not prevented HIV transmission in children and adolescents, they should not prevent the measures required to actualize an AIDS-free generation. We must reshape our religious beliefs, our cultural practices, and masculinities to protect children. And there's no contradiction. Religion and culture hold societies together, and children's protection is paramount in all faiths and culture. And this global alliance is essentially about how to protect children. I want to end by reaffirming the seriousness of the Organization of African First Ladies for Development in supporting the Global Alliance to End AIDS in Children. The DAR declaration issued from this meeting is our collective declaration. While First Ladies are not repositories of power, we have proximity to power. To be honest, our only real power is that we do not need to make an appointment to see the presidents of our respective countries. The Minister of Health of Angola spoke very eloquently about how powerful the First Lady of Angola has been in advocacy around HIV. And I can confirm that most First Ladies from most of the countries that are participating in the Global Alliance have shown similar commitment to that of the First Lady of Angola. Please rely on us as we all seek to translate political will into political action. We'll use our platforms to provide strong advocacy across the continent for women, adolescents, and children living with and affected by HIV. OAFLAD is humbled to be part of this gathering of leaders, united in a solemn vow and a clear plan of action to end AIDS in children once and for all. There's no higher priority for us than this, and we will not leave any child behind. Let's look after each other and be safe. Thank you.
We thank you very much. Distinguished ladies and gentlemen, the host minister, Honorable Umi Mwalimu, may I please welcome you to the podium. Please hold the declaration and the statement, the Dar es Salaam declaration in your hands. Yes, please come through. Ladies and gentlemen, please put your hands together. This is our article of work.
Excellencies, the guests of honor, ministers of health from 12 countries who are the members of the Global Alliance to End AIDS in Children by 2030. We have actually adopted a declaration which is known as the Dar es Salaam Declaration for Action to End AIDS in Tanzania. Now, I would like to ask the honorable ministers whether we have adopted the declaration or not. Adopted? Adopted. Thank you very much. Basically, what we have actually included into the declaration, we have the tools, the guidance, policies, and the knowledge we need in order to end AIDS in children. Thank you very much. Ladies and gentlemen, allow me now to welcome His Excellency, Dr. Constantine Chiwenga, the Vice President of Zimbabwe and Minister of Health, in order to deliver his statement. Warmly welcome, His Excellency.
Our guest of honor, the Vice President of the United Republic of Tanzania, Your Excellency Dr. Philip Isdor Mpango, Her Excellency, the First Lady of Namibia, I recognize you, Madam. Honorable Ministers of Health and from fellow partner countries of the first phase of the Global Alliance to End AIDS in Children by 2030. All protocols observed. And I have to recognize our host for the ministers, Honorable Mwalimu. Thank you once again, Your Excellency, the Vice President of the United Republic of Tanzania, for convening and hosting this political launch of the Global Alliance to End AIDS in Children by 2030. I wish to express my gratitude to you, fellow honorable ministers of the first phase of the Global Alliance, for the remarks you have delivered and the commitment you have made to deliver for women and children as we seek to end AIDS in children by 2030. I gave my remarks earlier on today and highlighted on the key activities that we carry out in Zimbabwe to fulfill the vision and objectives of the Global Alliance. We are strongly committed to attaining the ambitious targets that we have set for ourselves as a country. This should not just be a talk show, but should galvanize momentum and action as each and every one of us plays their part to end AIDS in children by 2030. As chair of the National Validation Committee for Eliminating Vertical Transmission of HIV in Zimbabwe, I commit to strengthening activities to prevent vertical transmission of HIV and to closing the treatment gap for children in need of antiretroviral treatment. Children are our future, the future parents and leaders of our nation. And we need to invest in their health and well-being. That's not a choice, but a must. We commit to supporting women and men in need of antiretroviral treatment to receive the treatment and care that they need for their own health, as well for preventing HIV transmission in children. We give our commitment towards addressing the structural detriment of health that prevent women, especially adolescents and young women, from accessing care. We will engage communities, including the women and men living with HIV and other networks, to move forward and address the unique challenges that confront them day to day. To this end, we commit to addressing and ending stigma and discrimination and other social ills such as harmful gender norms and sexual and gender-based violence that hinder progress towards ending AIDS in children by 2030. We recognize that all these commitments call for allocation of adequate resources and funding budgets. We are committed to increasing our budget allocation and domestic resources to support care and implementation of activities targeted at ending AIDS in children by 2030. We commit to having an accountability framework that allows for monitoring of progress towards attaining the targets we have set for ourselves. Where corrective action is needed, we will be able to take it and steer the ship in the right direction. We appreciate the involvement of other stakeholders in the Global Alliance. To this end, I wish to recognize UNAIDS, WHO, UNICEF, and our development partners and other funding contributions towards the effort. Allow me to express my gratitude once again to the government of the United Republic of Tanzania for hosting the political launch of the Global Alliance to End AIDS in Children by 2030. Failure is not an option, ladies and gentlemen, and this should be our rallying call as we move towards ending AIDS in children by 2030. Asante sana, I thank you.
Thank you, Your Excellency, Honorable Dr. Constantine Chiwenga, Vice President and Minister of Zimbabwe, for your emphatic wisdom. Honorable Minister of Health, Zanzibar, Honorable Mazrui, please, you have the honor of welcoming the guest of honor. If you would join me, please, in the spirit of the United Republic of Tanzania.
His Excellency Dr. Philip Isidore Mpango, Vice President of the Republic of Tanzania, His Excellency Retired General Dr. Constantine Chiwenga, Vice President and Minister of Health and Child Care, Republic of Zimbabwe, fellow ministers, all protocol observed. The government of the Republic of Tanzania renews its commitment to stand with 38.4 million people living with HIV around the world as we pursue our shared goal and global solidarity towards ending AIDS by 2030. Tanzania is proud to host the launch of the Global Alliance in Africa and commits to work in collaboration and in partnership with key stakeholders and inequalities that contribute to HIV infections in children and get the world back on track to end AIDS by 2030. The government of the Republic of Tanzania will intensify, speed up, scale up implementation of ongoing effective interventions and activities, introduce and roll out new evidence-based impactful interventions and activities across the 4 pillars of the Global Alliance Initiative to realize the desired goal. To conclude, I commend the global partnership and Tanzanian community on the tremendous progress we have made together in reaching where we are. These have been driven by smart investment enabling policy that we have made. Now we'll continue to maintain and sustain gains to reach HIV epidemic control in Tanzania, Africa, and the world. Now, ladies and gentlemen, join me in my invitation. I would like to invite His Excellency Dr. Philip Isidore Mpango, the Vice President of the Republic of Tanzania. Please, the floor is yours.
Please be seated. Your Excellency, Retired General Dr. Constantine Chiwenga, Vice President and Minister of Health and Child Care of the Republic of Zimbabwe, Your Excellency Monica Geingob, First Lady of the Republic of Namibia, Honorable Ume Mwalimu, Member of Parliament, Minister of Health of the United Republic of Tanzania. I recognize Honorable Mazrui, the Minister of Health, the Zanzibar government, honorable ministers of health from different countries, Ambassador Mbaruk, Deputy Minister of Foreign Affairs and East African Cooperation, Madam Winnie Byanyima, Director General of UNAIDS, Honorable Fatma Taufik, Chairperson of the Parliamentary Standing Committee on HIV/AIDS, Executive Director, UNICEF, UNAIDS officials, development partners present, senior government officials, all participants online, and I would in a particular way want to recognize in a very particular way the brave women living with AIDS, civil society representatives, members of the media, distinguished delegates, ladies and gentlemen. Good afternoon. I am greatly honored to have been given the opportunity to officiate the opening of the ministerial launch of the Global Alliance to End AIDS in Children by 2030 in Africa. On behalf of Her Excellency, Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania and the people of Tanzania, I wish to extend a warm welcome to all participants in this event being held here at the Julius Nyerere International Convention Center in Dar es Salaam. I also extend a proudly Tanzanian karibu sana to all our esteemed guests from outside Tanzania. Please feel at home. I bring to this conference fraternal greetings from Her Excellency President Samia Suluhu Hassan, who wished to be here but had to attend to other equally important matters. And please accept her message of appreciation to all of you, and especially to UNAIDS, UNICEF, WHO, and other international partners for initiating this new alliance that aims to address one of the most evident gaps in the fight against AIDS. Her Excellency the President wishes to assure you of Tanzania's commitment to this noble cause, and that her administration stands ready to work closely with all partners and communities to ensure that we succeed in ending AIDS in children by 2030. Excellencies, honorable ministers, the United Republic of Tanzania is indeed honored to host this very important high-level event to launch the Global Alliance in Africa after the decision in Montreal in August of 2022. And even more so, Tanzania is pleased to be amongst the 12 countries from the region that the first phase of the alliance will focus on. The government recognizes that providing essential treatment to women, adolescent girls, and children living with HIV is one of the key pillars of bringing about meaningful, inclusive, and sustainable development. We are therefore very pleased that the Alliance is giving a top priority to this cause. And looking at the 4 pillars of focus, we are optimistic that just as we made commendable progress in providing antiretroviral therapy to pregnant women living with HIV, we will also achieve the SDG target and end AIDS in children by 2030. Excellencies, honorable ministers, distinguished delegates, it is gratifying to note that over the years, there have been remarkable progress in slowing down the spread of HIV and reducing the number of AIDS-related deaths around the globe. However, the recent UNAIDS World AIDS Report of 2022 is pointing to dangerous inequalities and the harsh reality that the world continues to fail children and adolescents in the AIDS response. It has been sounded that as of 2021, 800,000 children living with HIV were still not on life-saving treatment. Even more alarming is the fact that AIDS is singled out as the #1 cause of death among adolescents in Africa and the second leading cause of death among adolescents globally. Even though we seem to know quite well what needs to be done to eliminate the vertical transmission of HIV and meet the treatment needs for children, still progress has stalled and the gap in treatment coverage between children and adults is widening. The two big questions we should then ask ourselves are, first, what is holding us back? And second, how do we move from where we are? I will not attempt to answer these questions because from what I have already heard, particularly in terms of the commitments made here, I think you have answered the questions and set the tone for action. I really loved the proposition that we should focus, among others, on data and information gaps to be addressed, as well as listening to the voices of people, and especially women living with HIV/AIDS. I'm also pleased to note that in its operations, the Alliance will incorporate lessons from the successes and shortcomings of the past initiatives. I hope this approach will point to the right direction and consequently help us come up with the plans that will close the treatment gap, encourage testing, prevent new HIV infections, and ensure that every child in Africa and globally living with HIV receives appropriate treatment by 2030. Excellencies and distinguished delegates, the government of Tanzania is committed to end the HIV pandemic as a public health threat by 2030 as part of the SDGs. As a country, we have made significant progress towards the set global HIV targets. As of September 2022, 92% of individuals knew their HIV status. 98.3% were kept on antiretroviral therapy, and up to 96.2% of those on ARVs attained viral suppression. And in addition, the six-phase government, in collaboration with partners like the Global Fund, PEPFAR, and private sector, continues to invest in HIV point of care and conventional testing laboratories, where in a span of 2 years, we have managed to increase their number from 54 to 130 laboratories. But despite the achievements recorded to date, our women are still facing a disproportionate HIV burden, mostly pronounced among adolescent girls and young women aged between 15 to 24, who are 2 to 3 times more affected than their male counterparts. Also, Tanzania is still facing pediatric new infections. Records show that in 2021, there were about 9,400 new child infections transmitted from mother to child. This is partly attributed to insufficient quality of care services, especially missed opportunity for HIV care, lack of treatment and support services, and antiretroviral during pregnancy and breastfeeding among HIV-positive mothers. In addition, we are also experiencing challenges when it comes to community engagement and ownership to support a comprehensive prevention of new infections,
through mother-to-child transmission. In cognizance of these shortcomings, the government continues to equip health facilities with appropriate tools to enhance HIV care and treatment services for pregnant women and children. From January to September 2022, 99% of first antenatal care attendees received HIV counseling and testing services, and among those tested, 2.9% were found to be HIV positive, and a total of 49,953, which is equivalent to 96%, were enrolled in prevention of mother-to-child transmission program and had access to ARVs. In addition, a total of 34,364, which is about 88%, HIV-exposed infants started on HIV prophylaxis and received the first HIV test at their second month. While we are optimistic with the achievements that have been realized, there is still more to be done to close the gap. It is therefore our expectation that through the implementation of the priorities outlined in the 4 pillars of the Global Alliance, member countries will be able to advance towards the goal of ensuring that our children are free from HIV by 2030. Excellencies, distinguished delegates, we firmly believe that there is a great need to have an integrated, inclusive, and multi-sectoral approach to addressing the structural barriers to healthy lives and well-being of children and women while strengthening community-led responses. Appreciating the implied large financial requirements, governments will have to harness private sector investment in this endeavor. All of us in our capacities must have a role to play in order to achieve our objective to end AIDS in children by 2030. I believe the launch of the Global Alliance is a step in the right direction. I therefore call upon each one of us to embrace the plans, marshal the resources, and move to a high implementation gear. We must not remain complacent as 2030 is at our doorstep. In order to make this alliance meaningful and successful in reality, we in Africa must continue to take deliberate measures to put in place the necessary policies and strategies, build capacities, and continuously monitor and evaluate progress. I have no doubt it can be done. What is needed is full commitment of will and purpose. However, we must also have plans to protect our children, women, and adolescents from unnecessary and risky exposures, such as early marriages, sexual violence, and all traditions that put them at risk, including female genital mutilation. Excellencies, honorable ministers, distinguished delegates, ladies and gentlemen, as I conclude my remarks, may I take this opportunity to thank all partners who have been working with us here in Tanzania in the health sector, and in particular with regard to the drive to achieve AIDS-related global targets. It is our humble plea that we continue to work together until we achieve our goals in fighting against AIDS. I wish to invite all our friends of Africa, other partners with advanced technologies, know-how, and financial capabilities to join us, especially on technology transfer, capacity building, research and data management, in order to develop sustainable and appropriate means to deal with the challenge at hand. Lastly, I urge my fellow African leaders to commit to this noble cause and demonstrate political leadership that will set the tone for the agreed priority actions to be taken in order to build on the momentum to end AIDS in children in our continent by 2030. Once again, thank you for giving me this time to deliver remarks on behalf of Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania. I now have the honor to formally declare open the ministerial launch of the new Global Alliance to End AIDS in Children by 2030 in our region. Let us make promises made in Montreal a reality. I thank you for your kind attention.
Ladies and gentlemen, please stand and applaud. Congratulations. And as we take our seats, I'm going to call for a photo op. And once again, I'd just like to, please take your seats. Thank you. Just like to let you know that the Vice President, our guest of honor, is leaving a little bit earlier than expected. And so we apologize for having shifted the program, but we will continue with it. As soon as he's gone, the Honorable Minister, the High Table will return. And so here are the pictures. Ministers of Health and representatives, please may I welcome you forward. Ras Dar es Salaam and Deputy Permanent Secretary Poral, please join us with on this picture. And the Chairman of the Parliamentary Committee, HIV and AIDS, please join us for the first photo on stage. Please enter through left and you will exit behind me, please. Honorable Ministers, please come through. You may leave your personal effects at your chair. We're going to call next after this the UN Family, Global Fund and PEPFAR. You will have your own special picture. Please mind the sockets on the floor as you come up. Please stand behind the chairs. Please stand behind the chairs. So all ministers of health and their representatives, the Ras Dar es Salaam, Permanent Secretary, Prime Minister's Office, Chairman of the Parliamentary Committee in this picture as well. As you exit to my left, I'm going to get an indication just now from the UN Family, Global Fund and PEPFAR. Please prepare, please begin to step out of your chairs. And please move towards the towards the stairs. Thank you very much, Honorable Ministers. We appreciate your patience. And once again, respectfully, we'll say that everybody will get a chance as per program, but we've had to allow our guest of honor to depart a little bit earlier as he's traveling. Thank you very much. And so the UN Family, Global Fund and PEPFAR, please come through. Please line up. Oh, that's a big group, eh? You can see how allied we are. Can I cut it off a little bit? It's a rather big group. So please, could we come a little bit closer to the chairs? Maybe let's cut it off. Let's do 2 quick groups. Very quickly, please, ladies and gentlemen, very quickly. Thank you very much for holding on the other side. Please move a little bit closer to the chairs. And if you're a little bit taller, group number 2. Thank you. Group number 2, please come through. Group number 2, please come through. Please come all the way to the very end. Waku, heads of CSOs, Mama Leticia, people living with HIV and AIDS, executive directors and EGPAF. You're next. Please come all the way to the very end. There's enough space. If you're tall, please stand behind the shoulders of someone, between the shoulders. Yes, well done. Sir, could I bring you all the way to the very end? Okay. CSOs, please, heads and executive directors, representatives from organizations of people living with HIV and AIDS and EGPAF. Mr. Leon, please find a vantage position. Secretariat, you are the final shot. Please, could you find your way to the big billboard with the guest of honor's picture, the Secretariat. Tunaomba viongozi kama ikiwezekana, and we're going to have to cut this picture as well. Please come all the way to the very end, all the way to the very end. All right, tunaikata your picture hapo. Cut the picture a little bit. Let's begin with the first group very quickly. Please come into the picture if you've already taken a few steps. All right, 1, 2, 3, smile all around. Thank you. Group number 2, very quickly. Group number 2, let's move. Come through. All the way to the very end. Please join me, last chair to the left. And ladies and gentlemen, after you've taken your picture, please return to your seats. We will proceed with the remaining statements from representatives. There's still enough space towards the end. Please face forward and smiles all around, please. Please face forward. And please don't cut in front of the cameras if you can. All right, group number 3, finally. And Secretariat, I want to see you. Where are you, the Secretariat? Ah, that's you. Okay, so you're coming in through for the final picture. Thank you, everyone, for your patience. I'm sorry that I'm rushing you. And let's put our hands together to the Secretariat. The work that's been done, please, ladies and gentlemen, culminates in the guest of honor officially launching. All the way to the very end, the Secretariat. Please take a slight step forward to allow others to get a bit of space. May we please return to our seats. And with that, ladies and gentlemen, distinguished ladies and gentlemen, I'm going to request that the high table rise, and we all rise in turn. And we're going to say, Jamhuri ya Muungano wa Tanzania, the work continues. Your Honor, thank you very much for gracing this event, for affirming Tanzania's commitment We will take a short sitting break for about 5 minutes or even less as we await the honorable host ministers to return. And let's prepare for the virtual statement from South Africa, please. Then we'll have a statement from Mozambique. I believe we'll have a video from Peter Sands and a statement from Cameroon. Thank you, Your Excellency. Please take your seats. Please take your seats. The high table is still seated at full strength, ladies and gentlemen. If you do feel the need to refresh, take a quick health break, you may, but we'll proceed immediately afterwards, after the host ministers come back. So once again, we're going to request a quick prep on the virtual statement from South Africa. Mozambique will follow next. We'll hear from Peter Sands and welcome a statement from Cameroon. I believe we'll have in-house statement from PEPFAR, Michelle Chevalier. There's a video from the WHO. The DRC representative, you'll also get a chance. And from Nigeria, before we close off with closing remarks from the host minister, Honorable Umi Mwalim. And we're ready to get underway. Are we ready with South Africa? Please give me an indication. Not yet. Oh, we're good to go.
Yes, program person, I'm available.
And we're happy that you are. Please proceed.
Right, thank you very much. So I will be reading the statement from the Honorable Minister of Health in South Africa, Dr. Tatu Chidari Gire. Can I proceed?
Kindly proceed. Do we have a picture? Do we have video of you? No, we have audio.
I'm actually in a car, but I can open my video. I'm not driving, but I'm in a car.
All right. Thank you very much. Please proceed. Please proceed.
Okay. Right. First, let me thank Your Excellency, Dr. Philip Mpango, Vice President of Tanzania, Your Excellency, Dr. Constantine Chiwenga, Vice President of Zimbabwe, Her Excellency Monica Jingos, First Lady of the Republic of Namibia, Honorable Umi Mwalimu, Minister of Health Tanzania, Honorable Dr. Nasoro Musuri, Minister of Health Zanzibar, my sister Winnie Dwanyima, Under Secretary General of the United Nations and Executive Director UNAIDS, Ms. Catherine Russell, Executive Director UNICEF, Ambassador Dr. John Kengasong, US Global AIDS Coordinator and Special Representative for Health Diplomacy, Dr. Matiti Somwedi, Regional Director, WHO Africa Region, Mr. Peter Sands, Executive Director of the Global Fund, Mr. Chief Lyons, President and CEO, ECPAF, representatives of communities, health ministers, all protocol observed. Good afternoon. Habari mchana. First and foremost, let me convey my most sincere apology for not being able to participate in person in this very important event, owing to the present government engagements taking place in my country. On behalf of the South African government, it gives me great honor to pledge our full support to this timely and inspiring initiative. This is a major priority for our government, health ministry, but also the broader members of society. We stand together with all the partners in the alliance to renew our commitment to this essential cause, and we will ensure that our efforts as a country and within existing platforms are fully utilized to end this pandemic and its impact on children. South Africa's participation at the political launch of the Alliance in Africa is the country's commitment to ensure children's rights for optimal survival, health, and development. And the South African National Development Plan 2030 seeks to achieve a long and healthy life for all South Africans, as well as improving the quality of healthcare services for children and service delivery in the goal of the Department of Health Strategic Plan. The pediatric HIV treatment program in South Africa has grown since its inception in 2004. And despite impressive scale-up of ARVs in children, the proportion of children started on ART and retained in care remains unacceptably low. An underlying constraint remains, and that of improving the support of vulnerable patients, especially pregnant and breastfeeding mothers, so that they are able to take ART consistently and ensure the protection of the next generation of our country, and for us to reach the goals of the 95-95-95 targets in children. To ensure that South Africa achieves the Global AIDS Alliance activities, we will focus on enhancing and integrating programs to maximize synergies, with emphasis on the following: engaging communities for people-centered approach, committing resources towards the development of integrated data collection systems for decision-making at all levels, capacitate and upskill health and social service workforce, in dealing with emerging epidemics threatening the well-being of vulnerable groups, intensifying our efforts to address and close the inequalities affecting key and vulnerable populations to ensure that no one is left behind. South Africa is committed to allocating domestic resources and collaborate with partners towards the implementation of the plan of action. We will ensure that our resources are efficiently and effectively utilized to protect those affected, fight stigma, and promote the well-being of children already living with HIV. Our future is built on the pillars of the partnership and collaboration, and together we will create a brighter future for African children. Asante sana, and over to you, Chairperson. Thank you.
Oh, thank you very much. Thank you very much. We very much appreciate that. All right, we may move over to, I believe, Honorable Minister, you're now chairing, although not in the red seat. May I please proceed with the statements? All right, yes, in my list, I have Mozambique, Peter Sands, and Cameroon in that order. So I am not acquainted. I'm going to perhaps not pronounce your name very well, but I'll read it as I believe it may be. Honorable Ms. Sauzinha Paula Agostinho, Permanent Secretary, Ministry of Health, Mozambique. You may punch me as you come to the lectern if I got the first name wrong. Ladies and gentlemen, your hands. This is a statement from Mozambique.
Muito obrigada. Boa tarde a todos. Senhora Ministra da Saúde da República Unida da Tanzânia, Excelência Vice-Presidente da República do Zimbábue, Sua Excelência a Primeira-Dama da República da Namíbia, distinguidos ministros da Saúde e representantes, caros parceiros e convidados presentes nesta sala, todo o protocolo observado. Em nome do Ministro da Saúde da República de Moçambique, Dr. Armindo Tiago, queremos transmitir a sua saudação a todos os presentes a este evento e agradecer a oportunidade de Moçambique fazer parte da Iniciativa Global para a Eliminação do SIDA Pediátrico até 2030, e acabamos de testemunhar o seu lançamento. Moçambique está entre os 10 países mais afetados globalmente pelo HIV-SIDA, com uma prevalência de 12,5 em indivíduos com 15 anos ou mais, segundo os dados do Inquérito Nacional de SIDA realizado em 2022. Estimativas atuais também mostram que cerca de 125 mil crianças de 0 a 14 anos vivem com HIV. Portanto, aumentar a cobertura do tratamento antirretroviral pediátrico, reduzir a taxa da transmissão vertical e reduzir a mortalidade nesta população constituem principais objetivos do nosso país. Reconhecendo o esforço que devemos incitar perante os múltiplos desafios, elaboramos o Plano da Aliança Global para a Eliminação do SIDA Pediátrico, com o envolvimento de todos os setores-chave na resposta ao HIV, que representa um marco importante para o país e que irá contribuir para reduzir as novas infecções nas crianças, adolescentes, mulheres, raparigas em idade reprodutiva. A declaração Dar Salam que adotamos traz os elementos pelos quais devemos incitar a nossa atenção. Assim, Moçambique compromete-se a, em primeiro lugar, continuar a mobilizar recursos domésticos e externos para cobrir as lacunas existentes, assegurando assim a complementaridade das intervenções. Em segundo lugar, pretendemos aumentar o acesso ao tratamento através do fortalecimento da resposta comunitária e, em terceiro lugar, acelerar a implementação do plano da tripla eliminação do HIV, sífilis e hepatites virais. estes compromissos irão ajudar o país a acabar com o SIDA pediátrico, contribuindo desta forma para a saúde das crianças do nosso país, na nossa região e de uma forma global. Para terminar, queremos usar desta oportunidade para mais uma vez agradecer aos parceiros desta iniciativa e de uma forma muito especial ao governo da Tanzânia, país vizinho e irmão, pelo acolhimento e pela excelente organização deste evento. Consideramos nós que todos juntos podemos fazer mais e melhor para as nossas crianças. Muito obrigada pela atenção. Asante sana.
Well, thank you very, very much. Much appreciated. I believe we have a video that we can follow now. From the Global Fund. Ladies and gentlemen, commitment from the Global Fund.
Excellencies, honourable ministers, dear colleagues, it's a great pleasure to join you today, even if only by video, for the official launch of the Global Alliance to End AIDS in Children by 2030 in Africa. This day is pivotal in shaping our collective path forward in facing an issue that really concerns me: children. Children who continue to be left behind. To end HIV as a public health threat, we must be laser focused on extending the gains we have made against the virus among all those at risk. At the moment, only half of the children living with HIV get the life-saving treatment they need. That is unacceptable. And it's also unacceptable that in 2021, 160,000 children were born with HIV. We know how to prevent this through effective identification of pregnant women with HIV and durable treatment throughout the pregnancy and breastfeeding periods. And we know how to get children the quality treatment they need through early identification and linkage to effective treatment and care. Yet, we are collectively failing these pregnant women, children, and adolescents at every step of the cascade. We are losing the fight against HIV and AIDS in these groups. The work of this alliance in changing this awful reality is critical. As donors, governments, civil society, communities, technical partners, and all other stakeholders, we must support this initiative by going all out to make tangible commitments to ending AIDS among children. We must work together to implement the concrete steps in the action plans that are being laid out at this meeting. The Global Fund stands in solidarity with the Alliance and is committed to accelerating progress in the fight against pediatric AIDS. With our country-led partnership model, we provide funding for HIV programs in over 100 countries, and the Global Fund supports HIV prevention and treatment programs for children and adolescents, including access to early infant diagnosis, innovative testing approaches, and family-focused service delivery. We support the transition to the latest child-friendly antiretroviral drug regimens for children, and indeed since mid-2022, the Global Fund has been procuring the recently approved pediatric dolutegravir formulation, which is more effective, cheaper, and better tolerated by children in more than 20 countries in which we invest. With the leadership of countries themselves, we are committed to doing more. Today, our challenge is to do all it takes to meet the targets set by this alliance. And we can draw inspiration from the many countries that are already leading the charge in seeking to meet these critical targets. For example, in South Africa, Uganda, and Zambia, more than 95% of pregnant women living with HIV were receiving ART in 2021. This is encouraging And while more needs to be done, these steps are taking us in the right direction. Every life saved, every infection averted has a multiplier effect across families, communities, and indeed entire countries. To achieve the targets set by the Alliance, we must move with determination to ensure that we reach all pregnant women, children and adolescents with the quality services they need to fight HIV and AIDS. Of course, this cannot be done without the high-level political commitment that is demonstrated by the ministries and other dignitaries present today. But high-level political commitment is only one piece of the puzzle. The key to meaningful engagement and lasting tangible change is garnering the support and active participation and leadership of the affected communities and other local on-the-ground stakeholders. This alliance must take a from-the-ground-up approach that promotes the leadership and engagement of national partners and affected communities. I cannot emphasize enough how important this is. Together, led by the communities most affected by HIV, we can, and we know we can, achieve remarkable results. And let's seize this opportunity to work in partnership to make sure that the action plans endorsed this morning are translated into concrete steps and implemented at scale. Let's change the glaring reality of pediatric AIDS today. In 2023, no child should be born with HIV, and no child should die from an AIDS-related illness. We have the tools, we have the knowledge and the resources. So now is the time to act, and let's get to work. Thank you.
Excellent. Thank you very much. Message there from Peter Sands from the Global Fund. And ladies and gentlemen, we may now proceed to a statement from the Cameroon. Dr. Hadija Hassantou. Karibu. Welcome. Please join me at the podium here. With your hands, ladies and gentlemen, please. Thank you.
Merci et bonjour. Je suis le docteur Zekakanou Florence, le chef de division de la coopération au ministère de la Santé du Cameroun, et je suis accompagnée de docteur Adidia qui est présente, qui est la secrétaire permanente du programme de lutte contre le sida. Au nom de notre ministre de la Santé, qui est empêché parce qu'en dernière minute, il y a une réunion au premier ministère, nous nous engageons vraiment à mettre fin au VIH pédiatrique d'ici 2030. Cependant, cette élimination ne pourra se faire sans l'accompagnement ouvert et conjoint des partenaires multilatéraux, bilatéraux, le secteur privé, la société civile, la communauté, ainsi que les autres secteurs comme l'éducation, le ministère de la promotion de la femme, des affaires sociales, le ministère de la planification de l'économie, le ministère des Finances. Parce qu'ensemble, nous pourrons mettre en œuvre le plan que nous avons élaboré, le cadre de performance et de résultats qui sera suivi et évalué aux yeux du monde entier. Je crois qu'ensemble, si nous agissons sur les leviers qui répondent aux 4 piliers spécifiquement, sur la décentralisation de la prise en charge pédiatrique, en incluant les mamans et la communauté elle-même pour la détection et la notification de ces enfants qui sont dans la communauté, l'implication inclusive de la société civile, sur la décentralisation de la prise en charge, surtout l'inclusion des autres services dans les formations sanitaires, le renforcement de la chaîne d'approvisionnement, l'amélioration des données, qui est la clé pour la prise de décision. Je crois qu'ensemble, nous pourrons éliminer le VIH pédiatrique d'ici 2030. Par ailleurs, nous ne pensons pas seulement au VIH, mais aussi à la triple élimination qui inclut la syphilis et l'hépatite virale B. Et au nom du ministre de la Santé que je représente, le docteur Manaouda Malachi Empêché, nous, Cameroun, nous nous engageons avec nos partenaires, toute l'équipe, à mettre en œuvre le plan écrit de manière conjointe pour l'élimination du VIH pédiatrique d'ici 2030. Je vous remercie.
Thank you very much for your statement. It's very much appreciated. And now we can call on the PEPFAR statement. Distinguished ladies and gentlemen, and I believe it will be read here in front of us by Michelle Chevalier. Ladies and gentlemen, let's put our hands together. And thank you for your patience. I know we've been waiting online for a very long time, but we have the moment now. All right, thank you.
So good afternoon, His Excellency Vice President and Minister Constantine Chiwenga, First Lady Monica Gengos, Honorable Minister Umi Mawulimo, and Ministers of Health and Government representatives of the 12 Global Alliance countries. Also extending greetings to the development partner representatives from UNAIDS, WHO, the Global Fund, EGPAF, and UNICEF. Also extending greetings to representatives from international and civil society organizations, and of course, to our PEPFAR Global Alliance country team representatives. The U.S. Global AIDS Coordinator, Ambassador John Nkingasong, sends his regrets that he had to depart early from the virtual meeting for another commitment, but he wanted me to deliver his remarks as a demonstration of solidarity and commitment to closing the treatment and prevention gaps in women and children through this alliance. Distinguished colleagues, I am so pleased to be able to join you today for the political launch of the Global Alliance to End AIDS in Children by 2030. I would like to extend my appreciation to the governments of the 12 Global Alliance countries, development partners, and civil society partners. Through your hard work and leadership over the past 20 years, we have accomplished a remarkable work together, eliminating HIV/AIDS as a public health threat. Through PEPFAR investments and collective action, today 12 high-burden countries reach 90-90-90 targets. 19.9 million women and men are on treatment. HIV-related deaths have declined by 68%. New HIV infections are reduced by 42%, and an estimated 5.5 million children were born HIV-free. As outlined in our 5-year strategy, PEPFAR is deeply committed to closing the equity gap for children by strategically partnering with national governments and global organizations to accelerate the scale-up of evidence-based approaches to meet mothers, children, and families where they are with services that they need. Although services have improved since 2010, gaps continue to exist in the portion of pregnant people receiving ART to prevent vertical HIV transmission, and inequities still exist among children in each of the 95 global HIV targets. Progress will be stalled unless we identify and address specific service delivery gaps and eliminate persistent policies and other structural barriers that prevent progress. Success will depend on continued investments in health systems, transformative partnerships, quality assured high fidelity evidence-based interventions. In COP22, PEPFAR launched the Accelerating Progress in Pediatrics and PMTCT, or the AP3 initiative, in 7 countries with the highest number of new HIV infections in children as a surge effort to provide accountability and improve the holistic care for pregnant and breastfeeding women and their infants. In COP23, PEPFAR will work with all stakeholders in AP3 and Global Alliance countries to engage community leadership and boldly innovate to achieve health equity for children as the first of its 5 strategic pillars. Closing the gap for children will require a laser focus and a steadfast commitment to hold ourselves, governments, and all partners accountable for results. I am confident that through our discussions during these 2 days, that we will develop a global plan for women and their children that is both achievable and sustainable. In partnership with the Global Alliance, PEPFAR commits to elevate the HIV/AIDS children's agenda to the highest political level within and across countries to mobilize the necessary political support needed to address rights, gender equality, and the social and structural barriers that hinder access to prevention and treatment services for children and their families. Thank you all for your ongoing dedication to improving the health outcomes for women and their children through the global call to action. PEPFAR looks forward to continuing to partner with you as we jointly move toward epidemic control and a healthier future for women and children. Thank you.
We're honored to have listened to that statement from PEPFAR. Thank you very much. I believe we have a final video before the next 2 statements. Are we ready? All right, let's proceed with it. And this is from the WHO. Ladies and gentlemen, your hands, please.
Your Excellency Philip Mpango, Vice President of the United Republic of Tanzania, Your Excellency First Lady Monica Genges, Your Excellency Minister Umi Mwalimu, Excellencies, dear colleagues and friends. More than 40 years since AIDS first emerged, we have come a long way in reducing infections in children and increasing access to treatment. But progress has stalled. We can all play a part in kickstarting progress and ending AIDS in children by 2030. We have 8 years and all the tools needed to make this a reality, but we need your commitment and action. We urge you all to aim for practical solutions that fit your context. Be innovative and do things differently, with families at the center and communities as our biggest allies. I'm delighted there is so much representation from communities today. Your leadership is crucial. We must commit to dealing with the stigma and discrimination, sexual and gender-based violence, and lack of supportive policies that young people face. We need an extra focus on those left behind. This global alliance was founded on country leadership, community ownership, multi-sectoral partnership, and high-level political commitment. WHO is proud to be your partner, and we're committed to delivering the technical leadership and policy implementation to realize our shared vision of ending AIDS in children by 2030. I thank you.
From Dr. Tedros himself. Fantastic. Can we move now to Dr. Patrice Nyembo, representing the DRC? Distinguished ladies and gentlemen, your hands once again. Karibu, Doctor. And we'll hear from Nigeria next.
Good afternoon. Je suis Dr. Ememboyo, Dr. Patricia est dans la salle. Donc, je vais prendre la parole au nom du ministre de la Santé de la République démocratique du Congo. honorables, Excellences, distinguée Première Dame, Madame la directrice exécutive de l'ONU-SIDA, Mesdames et Messieurs, à vos titres et qualités respectifs, tout protocole observé. Au nom de son Excellence, Dr Jean-Jacques Mbungani, ministre de la Santé publique, Hygiène et Prévention de la République démocratique du Congo, nous remercions le gouvernement tanzanien pour l'accueil et l'hospitalité. Nous félicitons les organisateurs pour cette opportunité et leur accompagnement. Nous remercions tous les pays et toutes les organisations présentes dans ces assises pour les échanges, combien enrichissants. En rapport avec le plan d'action de notre pays, nous tenons à affirmer deux actions principales qui nous paraissent déterminantes, à savoir s'engager et agir. En effet, le gouvernement de la République démocratique du Congo reste engagé dans l'Alliance globale pour mettre fin au sida pédiatrique d'ici 2030. Ainsi, avec l'augmentation de la part de la santé dans le budget de l'État pour l'exercice 2023, le gouvernement va allouer des ressources conséquentes pour la mise en œuvre du plan d'action consolidé ici à Dar es Salaam et des priorités clairement identifiées. Aussi, nous sollicitons la contribution de partenaires techniques et financiers pour une mobilisation suffisante de ressources. En outre, nous devons agir, oui, agir et agir autrement. Ces actions devront notamment permettre de mobiliser toutes les parties prenantes pour une véritable synergie, soutenir la décentralisation dans la planification, la mise en œuvre et l'évaluation des interventions pour une meilleure appropriation des autorités locales, d'étendre les approches communautaires à travers toutes les provinces du pays et de renforcer la promotion du genre et de droits humains pour lutter contre la discrimination et la stigmatisation à l'égard de personnes infectées et affectées par le VIH-Sida. Honorable, Excellences, distinguée Première Dame, Madame la directrice exécutive de l'ONU-SIDA, Mesdames et Messieurs, nous voudrions terminer notre mot en lançant un vibrant appel où des milliers de femmes et des enfants de Goma, de Beni et de Luturi qui, malgré de nombreux efforts, ne peuvent pas accéder aux services de santé ni du VIH, en particulier à cause de la guerre d'agression qui sévit dans la partie orientale de la République démocratique du Congo. C'est sur ces cris de cœur que je vous remercie. Merci beaucoup.
Thank you very much for the statement. Your Excellency, distinguished ladies and gentlemen, we'll now hear from Nigeria, Dr. Emo Alex Oko. Please put your hands together as the good doctor comes through. And after these remarks, I will hand this over to you, the chair of this session, Honorable Umi Mwalimu, for the closure.
Your Excellency, guest of honor, the Vice President of the Republic of Zimbabwe, the First Lady of Namibia, our host minister, Minister of Health, United Republic of Tanzania, please permit me to align with already established protocols.
I'm personally delighted to have had the privilege of being a part of the journey from Montreal to Dar es Salaam. I am representing the Honorable Minister of Health, Nigeria, Dr. Osage Ehanire. I will be reading his statement. Excellencies, delegates, ladies and gentlemen, it is a pleasure to participate in this launch in Tanzania, East Africa, of the Global Alliance to End AIDS in Children. I shall first express appreciation on behalf of the government and people of Nigeria to our partners who are well represented here for putting their full weight behind the agenda to end AIDS in children by 2030, and for sustaining momentum from the start in Montreal to this day in Dar es Salaam. I commend you all. To keep up the momentum of this alliance, we recommitted to end AIDS in children and eliminate vertical transmission as Nigeria's priorities, for which purpose broad stakeholder consultations were held at state and national levels, resulting in development of a country action plan, which in alignment with the 4 pillars of the alliance addresses the following elements. 1, scaling up PMTCT service availability to all locations where pregnant women receive antenatal care in public and private facilities, health facilities, including traditional birth attendants and other informal providers. 2, mobilization to provide access to antenatal care and PMTCT services for women at home who do not receive antenatal care, usually for sociocultural reasons. Testing children of adult persons living with HIV who are on antiretroviral therapy. And 4, updating our data systems to capture progress, identify persisting gaps, and inform other action. We have moved from plan to action and commenced the scale-up of PMTCT, as well as other key components of the plan, using resources from government, reprogrammed Global Fund resources, and existing funds in PEPFAR COP22. We aim to have all aspects of the plan fully operational nationwide by the end of 2024. The action plans have been incorporated in the National Health Sector HIV Response Plan and our priorities for both Global Fund, NFM4, and PEPFAR COP23 grants. I am pleased to draw attention to the inclusiveness of the planning processes, being that people living with HIV, including women and youth, participated in the development of the plans at national and subnational levels. Implementation will also be inclusive and involve other sectors, tiers of governance and stakeholders down to ward level. I shall close by thanking our partners, in particular UNAIDS, WHO, and UNICEF, for the support we have enjoyed to get this far. We especially appreciate the peer review mechanism established to support country-to-country learning, while looking forward to working with you to now change the lives of children who had been hitherto left behind. I thank you for your attention.
And we thank you for your firm statement. Thank you very much. So let's put our hands together to ourselves, to all the ministers and representatives. Congratulations. Honorable Chair, may I move it over to you?
Honorable Ministers, our colleagues and partners, thank you once again for attending this meeting, but more importantly, for your commitment and passion to end HIV/AIDS in children. Allow me to thank His Excellency, the Vice President of Zimbabwe, for his participation throughout this meeting. Thank you very much, Your Excellency. And to our First Lady from Namibia, Asante Sana, Mama Monica, my dear sister Winnie, and your team from UNAIDS. Thank you very much, the UN community, UNAIDS, UNICEF, WHO, and our partners, the Global Fund, paper, civil society organization, faith-based organization, media, interpreters, and IT. Asanteni sana. Thank you very much. And my apologies for keeping you up to this time without giving you lunch. And so, bon voyage for those who are traveling back home. Safari njema. I look forward to see you in your respective countries. At least also to note that there is a progress in terms of eliminating mother to child transmission. And warmly welcome to Tanzania, Dar es Salaam and Dodoma. Karibuni tena. Asanteni sana. May God bless you. Thank you very much.
All right. Honorable ministers and high table, before you leave, I'm being requested that we do a photo moment. Yes, again, but we'll do it very quickly if you don't mind. Secretariat. Country delegations would love to take a picture. Maybe I could do it very quickly within 2-3 minutes. Okay. Honorable ministers, please come through. Yes, I can call the country delegations.